Hello, hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is January 5th, 2020. Oh my God, it's our first support group meeting of a brand new year and a brand new decade. I cannot believe how quickly time has flown by. It is amazing. And so, the purpose of this meeting is to make you so strong, so knowledgeable, so informed that no one can ever mess with you again. That as you go through 2020, you will be treated with kindness, respect, compassion. You will walk into every doctor's appointment so knowledgeable, so informed, ready to kick some butt in the new year and get yourself better, right? Absolutely right. So I do these support group meetings well, I do them several times a month. Our two scheduled meetings are the first and the third Sunday. Hello, YouTube. Uh, on the first and third Sunday, 12:30 p.m. Pacific time, 3:30 p.m. Eastern Standard Time. Hello, Deborah. Nice to see you. And then I do drop-in meetings on other days, depending upon what my schedule is like, because my schedule is getting really, really crazy right now. It's nice to see you. Happy New Year, everybody. Happy New Year. We are letting go of the crap of 2019. It is over. It is done. We're not going to dwell on it. We're not going to agonize over it. For those people who didn't treat us well, we are moving forward. We do not need to remember and rehash the weird things that happened in 2019. Rather, you got to focus every day on being a new opportunity, a new chapter in your life that you get to control. Now, I don't know what's going on with Facebook here. Facebook is being very, very weird. We simulcast on Facebook and YouTube. Hello, Molly. Hi, Karen. Hi, Deborah. Oh, okay. Hold on. Let's try this. Is this better? Leave it to me to forget to put the mic next to my mouth. Molly, is that better? Testing 1, 2, 3. Testing 1, 2, 3. Brian says, halfway through first bottle of Bladder Builder, got rid of Elmeron. Very, very smart move, in my opinion, Brian. Hello, meme. All right. Sorry about that, guys. There's so many little bits and pieces to put together. Oh my God, I didn't even start streaming yet. Hold on a sec. I got to record this. I got stuff I want to talk about. I want to save. Oh, thank you, Wendy. Thank you very, very much. So let's just give it a couple minutes. Let's let some people come in. Facebook, you're being very weird. It seems like it's shutting down for you guys on Facebook every now and then. Ma'am, where can you get Bladder Builder? You can get it right over here, right on our website, icnetwork.org. Just click on store and you'll be fine. You'll get it right over there. We are the exclusive distributor of Bladder Builder, Bladder Rest, the Bladder Smart Low Acid Multivitamin, and Peora. Testing 1, 2, 3. Testing 1, 2, 3. Facebook, how is the sound? Are you guys okay with the sound? So y'all have your Christmas trees put away? I got mine put away a couple days ago on Friday. As I was doing 2 coaching sessions with IC patients, I had my little headset on. Mem said, you stopped all your meds 1 month ago. Why? I mean, I understand stopping Elmeron, especially with the latest research study showing that Elmeron appears to cause some progressive damage over time. But is there another reason why you stopped all your meds? Come on, Facebook. Are you working? Hey guys, for those of you who are here on Facebook, could you go ahead and please announce it? If you could share this in your groups, that would be great. I'm going to do that too. Here, hold on a sec. So I got a whole bunch of stuff I want to talk to you guys about. A whole bunch of stuff. Like a whole bunch of stuff. But here, hold on a sec. I do not understand what is happening. Oh, there we go. Facebook is glitch central today. Crap. Don't you hate it when that happens? Okay, join me for a live IC support group meeting happening right now. Alrighty then. Yay! Okay. Hello, Facebook. Yes, you appear to be working now. Maybe. Hope so. So Mem says, I stopped all my meds 1 month ago. You were having nightmares. So, Mem, the odds are the nightmares were probably coming from hydroxyzine. Were you taking Atarax or Visceral? That's why I took Atarax or Visceral very, very successfully for almost 10 years. I found it remarkably helpful, but eventually experienced the most common side effect of Visceral or hydroxyzine or Atarax, and that is nightmares, also night terrors. That's one of the, when we think about oral therapies for interstitial cystitis, we're thinking about using an antihistamine. One of the ways we describe IC is it's kind of like having 1,000 or 100 mosquito bites at once in your bladder, where if you have IC subtype 2 bladder wall driven, the odds are you have basically the equivalent of a skin knee in your bladder. You know how when you fall and skin your knee, you get lots of little tiny wounds on your knee, and so imagine that happening in your bladder. Unfortunately, then what happens is urine goes into that wound. Urine goes into that wound and provokes some of that irritation and discomfort. And what happens when a mosquito bite injects you with venom? The mast cells in that tissue start releasing histamine. Histamine causes swelling, it causes itching, it causes redness. Well, when urine enters a wound in your bladder, it does exactly the same thing. It causes mast cells to release histamine. And let me tell you, my friends, that absolutely sucks. And so using an antihistamine on a daily basis is a really solid strategy. And the most common antihistamine, the antihistamine which is believed to reach the bladder more effectively than really any other antihistamine, is going to be hydroxyzine. In generic form, it's called Atarax or hydroxyzine hydrochloride. In the other brand name is Visceral, also known as hydroxyzine pamoate. Of the two, hydroxyzine pamoate is more tolerable than hydroxyzine hydrochloride. Visceral is really better than Atarax, especially if you're someone like me where you have a lot of side effects. You're prone to weird things happening with side effects. The very, very good chance that you might react to the Atarax, but the Visceral is much, much better. So the side effects of hydroxyzine are a little bit of dry mouth, a little bit of dry eyes, but it has a very, very strong beneficial side effect. And that beneficial side effect is it has a very nice anti-anxiety effect. And like seriously, people, when you're in pain, you're anxious. And living in anxiety every day takes a toll on your body. It can intensify pain. Your brain, if pain is accompanied by anxiety, your brain will intensify that pain. If your pain is accompanied by laughter, your brain will minimize that pain. So we always want to try to address anxiety. So the cool thing about hydroxyzine is it has a very nice beneficial anti-anxiety effect, which is really why I took it. Unfortunately, the main side effect of hydroxyzine is, in fact, messing with your dreams. We call them hydroxyzine dreams. And so, if you're having a good dream, it becomes a spectacular dream. It's like the highlight of your life. If you're having a good sex dream, it's like the best sex of your life. If you're having a nightmare, it becomes a night terror. And night terrors are exactly why I stopped hydroxy. I knew exactly what it was. I had this terrible dream where it was like I was witnessing my family being murdered or something like that. It was awful. Like I was like screaming for help in this dream. And as soon as I woke up, I knew exactly what it was. I knew it was a night terror. And that's why I made the decision, ma'am, or I don't know if I'm pronouncing your name right. Me here now. Okay. Anyway, that's why I stopped the hydroxyzine. So the odds are it's probably the hydroxyzine. So you could talk to your doctor, let your doctor know that you're having nightmares, night terrors from it. You could reduce the dosage of the hydroxyzine. Also, ask your doctor if it would be okay for you to reduce the dose. The odds are it probably will be. The nice thing about hydroxyzine is that you don't it's very easy to get on and get off of. There's no tolerance level. There's no um side effects from getting off of it, or you don't go through any tolerance reaction. You know what I mean. It's not like some other medications where you become dependent on it, and getting off of it's very hard. Hydroxyzine seems to be remarkably easy. I was able to stop and start it many times over 10 years and never had a problem with it. But anyway, as always, talk with your doctors. All right, guys. So here, hold on a sec. I got to pull something up here real quick on my computer. I don't want to do it on my other computer. So. Let's see. All right, where'd I put it? There it is. Woohoo! Okay. So, I don't know about you. I Everybody I'm talking to in California, 2019 kicked our butts. I am not lying. It was an exhausting year. Absolutely exhausting year. And I hit a veritable wall. At the first, honestly, in 25 years running the IC network, I have never needed to stop working until the Monday before Christmas. It was like noon. I was hanging on by a thread, just emotionally, physically, mentally exhausted. Worked with somebody on the phone, and I just went, you know what? I'm not my best. I am not my best. So I took my first extended break, other than having cancer surgery, um, over Christmas and New Year's. And I didn't really do much of anything. And it was glorious. It was glorious. So, for those of you out there who are working your tushies off, please make sure you take time and rest, because we all need rest. We all need comfort. We all need support. The best part of the holidays to me was sitting by the fire with a book or laying on my couch and just blissfully reading and not thinking about anything. So, starting a new year is always an opportunity. And I am starting the new year. I've got two clear resolutions, and then one thing I'm trying to do every day. So, resolution number one is no more reading in bed with my Kindle. I am so sick of going from computer screen to computer screen to computer screen all day. It's like every morning I wake up, I got my iPad in my bed, I start answering email in my bed. Then I come to work, and then I work here. And then when I go make dinner, I have my Kindle and I watch TV on my Kindle. And then after that, I come back and I might play a couple of games on my computer. Then I go to bed and I'm looking at my damn Kindle again. If there's one thing that really frustrated me about 2019 is I was stuck on screens. And so my resolution for this year is computers are off at 8. And if I want to read on my Kindle at night, I cannot be in bed. If I'm going to read in bed, it's got to be a real book. So that's resolution number one. Um, Resolution number two is I am going with I am statements. And I want you guys to do this too. Rather than saying I am not, I'm changing this. I listened to a podcast by Oprah Winfrey and Joel Osteen, but Oprah Winfrey, she's amazing. I just love her. And it was the power of I am. I am strong. I'm confident. I am healthy. I am brave. I am courageous. And this is what I want you to do too. I don't want you to walk into a doctor's office and say, I give up. Everything fails. Nothing has worked for me. Come on. Every day's a new day. Every day's a new opportunity. I am strong today. I want you, what's the whole purpose of me doing these support group meetings, right? Like, seriously, I want you so strong, so knowledgeable, so informed that no one can ever mess with you again. again, right? I want you to be able to walk with confidence into any family gathering, anybody who questions you, like my brother did. My brother nailed me on New Year's Day. It's like, what? What? Why? Why? He, my mom called him. He was in Sacramento where he lives. And my mom, called him to wish him a happy new year. And she goes, "Hey, Jill, you want to talk to him?" Sure. Get him on the phone, ask him how he's doing, ask him about his schedule for the semester, yada, yada, yada. We have our talk. Get ready here, Jack. Dad wants to talk to you. He goes, "Wait, I want to talk to you first. I want to talk to you first." And he starts yelling at me because I don't support our current president. And it's like, so we have this like 10-minute discussion, and it's like, but I mean, like his voice is really raised. He's like, and I don't need to repeat what he was saying, other than he was saying he was being quite dismissive. And then finally he crossed the line. The message, debate the issue, not the moral character of the people involved. He crossed that line and said something that attacked me personally. Something that went back to high school, something my best friend and I said. And he's like, "I remember when you said this, and I lost all respect for you in high school." I'm like, "Jack, that's fucking 30 years old. I was a kid. Why are you bringing that up now? Every kid says stupid things, right?" And I swore at him, and I'm sorry. I just dropped the F-bomb here. But anyway, the difference is I called him on it. The difference is I stood up for myself. He might be 8 years older, but I don't care. I don't care. Nobody's messing with me anymore. And I don't want anybody to be able to mess with you. Period. End of story. IC is not all in your head. IC is real. Real. IC is treatable. There is no shame. There is no blame in having pelvic pain. End of story. So my purpose here is to just give you a lot of ammunition in a good way, so that your knowledge level is so high. Like he didn't have the audacity to attack me about IC, because I will just wrap him up, like he's never been wrapped up before. He cannot out talk me about interstitial cystitis or pelvic pain or anything like that. And when people lose it anyway, really what it says, it's about them. It's not about you. And obviously he was having a really bad day, and I was a nice target, and I called him on it, and that's okay. Everything's fine now. He apologized. We're good. And so again, getting back to I am statements. I am strong. I am confident. I am courageous. I dare you. I double dog dare you every single day to start with 5 or 10 statements like that. I am pretty. You're pretty. No one can say you're not. You can be pretty on the inside. You can be you're just pretty. You're just beautiful. However you are. However you are. You are a gift to this planet. You are a gift to your friends. You are a gift to your family, right? Okay, there was one more affirmation in there, and I've forgotten what it is already. I mean, there's one more resolution in there, and I've forgotten it. Okay. Anyway, enough on that. Let me just go ahead and introduce myself. You're going to think I'm a nut, right? So my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I am the longest serving IC support group leader in the United States. I have been a support group leader since 1993. That makes 27 years this year. Holy hell, how did that happen? Even more so, I was so young back then. I have 3 college degrees. I have a degree in chemistry. I have a degree in pharmacology, also known as drug development. I have a master's degree in psychology, and the IC Network was indeed my PhD doctoral dissertation proposal on how to bring support to somebody online. The great irony is that we are rated #1 by Harvard Medical School and the University of London for our website and the support services we offer and the quality and content of our, the quality of our information. And yet, honestly, I couldn't finish my PhD. So I do not have that PhD that I really wanted. Maybe when I'm 80, that's going to happen, right? I'm also a presidential fellow. I was very, very blessed that when I was in graduate school, um, I was named one of two presidential fellows by George W. Bush back many, many years ago for my work in graduate school. So I feel like I'm bringing some pretty good skills to the table to lead a support group meeting with you. I do want to say that a lot of the information you're going to hear from me today, potentially your doctor may not have heard. Why? Because it's my job. Every day I read research studies. Every day I read journal articles. Every day I write stories. Your doctor, in contrast, you know, if you're lucky, he might read an IC article once or twice a year. And so there's a very, very good chance you might hear something from me today that your doctor will be unfamiliar with, that you will then perhaps bring back to them. Some doctors receptive, some doctors not receptive. I was working with a IC patient on Friday who stunningly had been to the ophthalmologist, had been diagnosed with pigmentary maculopathy because of Elmeron use, yet her urologist refused to believe that Elmeron caused eye issues. Just wouldn't hear it. Wouldn't hear it, didn't believe it. And so I gave her, I sent her, I think I did. Ooh, if I haven't, hon, whoever you are, I will send it to you on Monday because I've got it in my email. I'm going to send her the journal article so that she can give that to her doctor to prove it. Right. So, anyway, so if you hear something interesting, feel free to come to our website right on over here, icnetwork.org. I'm updating that constantly. I just built a brand new section on that website over the holiday called Confusable Conditions. All the conditions that you want to rule out as you're considering a diagnosis of IC. In fact, I've got it right here on my screen. Worked my little tushy off of it the last couple of days. So we got a brand new section over there. I have a couple of things, though, that I think we need to talk about. Hi, Carol. Hi, Sarah. Hi, Molly. Molly, I had my cystoscopy in November. You've been in pain ever since. Why? Molly, was it a plain cysto or was it a hydrodistension with cystoscopy? Let me just say, too, that when I do these support group meetings, generally I spend the first 30 minutes to an hour doing educational content. Then I'll do 2 hours of questions, usually, and then usually some sort of giveaway at some point in time. So stick around. If you stick around to the end, you might actually win a contest because I always have good things to do. Let me also take a moment and I want to thank our sponsor. Our sponsor for these life support streams is Preleaf. Preleaf is the oldest supplement that has been out in the IC world now for 25 plus years. It is an acid reducer. It is not a bladder treatment. It is not NIC treatment. What this is going to do is reduce the acid level in your urine so that it won't be so irritating if you happen to have IC subtype 1 or IC subtype 2, which would give you tremendous sensitivity to foods and acids. So if you've never tried Preleaf before, give it a shot. A little calcium glycerophosphate, a little tiny pill. You only take 1 to 2 before a meal. It's remarkably helpful, very, very few side effects. However, I want to give you a caveat. You do not eat this like candy. If you eat this like candy, you're going to get way, way, way too much calcium in your bloodstream and in your kidneys, and you could end up with kidney stones. You could end up with kidney stones, and that is not a good thing, my friend. Not a good thing at all. All right, here, hold on. I got to pull up an article over here real quick. Actually, I can pull it up. Let me see if I can pull it up on this one. For those of you who don't know, if you can follow me on Twitter, I'm ICN Jill. You can follow us on Facebook here. We don't not too involved on Instagram. Do have a fairly big Pinterest group, but we're going to be making changes for that in the near future if I can hire somebody who to do this for me. All right, hold on a sec. Where is it? And you know, it's not a support group meeting if something doesn't fall. So if something falls, you know, that's just our little guardian angels telling us that they're here and present. All righty. Is it here? There it is. Hold on a sec. Okay, here we go. So, this is what I needed. Come on, computer. Yeah, yeah, yeah. Happy New Year, Carol. Happy New Year, Wendy. Molly says so she's had pain. She's been in pain since she had a cystoscopy, and it was only a plain cysto. It was not a hydrodistension with cystoscopy. Okay, now that's really very odd. Molly, that's very, very odd. So the only time we ever really see complications with a cystoscopy is if maybe they push the cystoscope in too far and they damage your bladder, or if you've acquired a post-procedure infection. That's really, really odd, my friend. All right. If Eileen says, I've been sick for 4 days. My bladder is in pain today. You're from your cold and flu strategies. So this is the first thing we're going to talk about today. We're going to talk about IC friendly cold and flu strategies, because what they're all saying is that this basically is going to be the worst flu season in decades. And I don't know about you, but that's pretty darn scary. I had a chance to go to the movies and I passed. It's like, no, I do not want to bring flu home to my parents. And so I wanted to just take a little bit of time and go over some of the bladder friendly cold and flu tips so that you have some ammunition and resources if you happen to get sick. So, what we did last year is we surveyed more than 100 patients and we asked them what their best cold and flu strategy tips were. And these are the results. Now, we've done this before over the years. You can already find over on our website another article that talks about this. Um, but it was very, very interesting to actually survey patients and ask what was the most effective for them. And the theme here is honey. Honey, 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 honey. In every single category, from sore throats to cough drops to everything, the best products were products that had honey in them. So, the favorite sore throat product that's the most bladder friendly for IC patients is by far honey lozenges. So there are a lot of different brand names that do honey formulations. Honey and lemon, a honey and lemon, they don't necessarily have a lot of acid in them. I mean, normally it's lemon flavoring, but if you can go for the straight honey or do hot water with honey, or if you can get a honey sucker, that is by far 41% of patients said they used honey lozenges very, very successfully. The next sore throat product was Ricola lozenges. The Ricola berry lozenges, 37%, Luden's, chloroseptic spray, or zinc. And in terms of products, the brand names, the best brand name that was recommended was Pine Brothers throat relief, natural honey. So pine, like the tree, Pine, or Zarbee's, Zarbees. They're listed not only as bladder friendly, but calming and soothing to a tender and painful throat. Other alternative products that were mentioned, but not by as many, were doTERRA On Guard Protecting Throat Drops, Boiron Throat Calm, Pine Brothers Honey Throat Drops, Zarbee's, and Open Nature. And you know what? If let me just go ahead and post this link. I'm going to post this link in Facebook. Whoops. Oh my God. I almost accidentally do that. All right, YouTube, I'm going to post this link for you too. All right. Okay. I will tell you, for me, because I had a sore throat a couple of days ago, my tonsils were really red and inflamed and irritated. Um, I really like, oh, come on, what's it called? They're in, oh, come on. Here, hold on. I'll go get it. Got it. Got it. Got it. Got it. Gosh, you know what? It's really hot in here. I'm gonna have to put my hair up. Hold on. Like I am so hot right now. It's ridiculous. Okay, hold on. Okay. Whew. Sucrets. Like my favorite by far is sucrets, but not a lot of people in our survey said that. Um, okay, but look, Honey's cough drops, Burt's Bees, honey throat drops. Even I think this one's pretty darn good. Hall's cough drops, Chloraseptic sore throat drops, and this is my last of my sucrets. I think sucrets actually has the best long-term effect. But if you need immediate sore throat relief, you go with a chloraseptic spray or a chloraseptic lozenge. These are really, 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 really good. Okay, favorite cough drops. Hall cough drops. Hello. Hello. Hall's honey cough drops. Ricola cough drops, which I didn't bring the bag in. Robitussin honey cough and congestion. Robitussin maximum strength. Ludens, Delsym, and Vicks NyQuil. And like honestly, seriously, people, if you don't have a tub of Vicks Vapor Rub next to your bed that you can use, hold on. I'm so weird. I'm so weird. I have a mirror effect here. If you're not using Vicks Vapor Rub every night when you've got a cold, you're being silly because there's nothing like Vicks Vapor Rub for killing your nose for opening up your nose and your sinus passages. They're absolutely fabulous. I do want to kind of give a warning though. My mom is an example. She has IC like I do. She's got Sjogren's syndrome. I have a variant of Sjogren's syndrome called Sika. She struggles with very, very dry mouth. And as a consequence, she has sucked on Luden's cough drops and Vicks cough drops for decades. And menthol cough drops. And unfortunately, her stomach started bleeding and she became anemic. She was doing so much menthol, side effect of menthol. Now, you guys, this is not for the average cold. This is somebody who would like suck on a pack a day for years. That it finally really damaged her stomach and she became anemic. So remember, if you're going to suck on something every day, do something natural like honey. Don't do something that's mentholated. Okay. So there's your favorite cough drops. Also, using a humidifier is really important. I've got a humidifier right now going on in my bedroom. People also talked about Buckley's cough products, Mucinex, Adult Tosin, and of course, Vicks. What are the best flavors? What are the best flavors that people like in the IC community? Number one, honey, 70%. Number two, cherry. Number three, menthol. And only a very, very small number of patients really like lemon. What's your favorite decongestion products? Mucinex, Vicks Vapor Rub, Sudafed, which really surprises me because so many of us are really, really sensitive. And Sudafed for me makes my heart race, so I cannot do Sudafed, and Vicks NyQuil. But the doTERRA Breathe Blend product line got a lot of good mentions. Olbas, the Olbas has a wonderful inhaler, a nasal inhaler, just like Vicks Vapor Rub does. It's really quite good. It's a little bit minty. I really like it. Tea tree oil, and ultimately, there's a wonderful herbal tea called Breathe Easy by Traditional Medicinals. It's a eucalyptus mint tea that gets rave reviews. Also, if you don't know, Starbucks has what they call a medicine bomb herbal tea, and it is a combination of their peach tranquility combined with mint, and they use it. They put honey in it, and if you're not IC subtype 1, subtype 2, where you don't have that much bladder sensitivity, you can also have them put a little bit of lemonade in it, and I'm telling you, it is the bomb. It is so, so, so good. So if you're just out and you're feeling, like your throat is on fire, or whatever, you're just feeling ill, Try a medicine balm herbal tea. You got your choice of either a green tea that's caffeinated, which of course not so good, or you can just get their plain herbal tea, which is what I do. What do you do when you can't stop coughing? Hot water with honey, hot chamomile tea with honey, hot mint tea, mucinex, peppermint hard candies, honey, lemon, and hot water. I was doing um, honey in hot water for a couple of days. And there are moments when if you got a really, really, really bad cough, something equivalent to whooping cough, you might need an opiate. You might need a codeine cough syrup. Make sure you let your doctor know if you're struggling, if you're scared, if you're gasping for breath, anything at all like that. You have an unresolved fever, a fever that is worsening, if you're bleeding, if you're coughing up blood, anything at all like that, guys. Seriously, get your little tush over to your doctor because you might have something else going on. Homemade bone broth, homemade chicken soup, anything at all like that. You want to go back to really good, simple, healthy, fresh foods. Not the time to be eating a lot of sugar and a lot of junk food, which of course is hard after the holidays because we've all been eating junk food. So if you come on over to this page, the page that I linked here, you can see a lot of here's 90 responses to your favorite cold and flu strategy, airborne tabs, Zicam nasal swabs, zinc supplements, right from other IC patients. Give those a shot. Um, and let's see what you think. Let me just go get one other thing I'm doing this year. I'll be right back. Hold on. And hopefully y'all got your flu shots too, right? Did y'all get your flu shots? I get mine early. Because again, I've got elderly folks here, and my worst fear is bringing home something that would make them so ill they could die from it. So I'm very, very careful. Elderberry, very, very IC friendly. I don't think I've ever had anybody call and say they've had a flare from elderberry. And this, whether it's elderberry syrup or in this case, elderberry gummies, this is something else that you might find helpful during cold and flu season. All right. Let me see if there's anything else here that I missed. Yeah. Okay. So I will let you guys read that article. And I sincerely hope and pray that you have a easy winter and that you are not struck by the flu, you and your family. Becky says, you're incredible, Jill. The IC Network. Oh, thank you, hon. Thank you, thank you, thank you. Hi, Sherry. Hi, Jana. All right, let's take some of your questions. Molly says, I was on hydroxyzine 100 years ago. It helped me sleep, no side effects. Yeah. The only other side effect I ever had from hydroxyzine was it made me a little bit less heat tolerant. So normally for me, I grew up as a tennis player. The best days were days when it was 100 degrees and I was playing. When I was taking hydroxyzine, I was much less heat tolerant. I felt ill if it was over 90. And I'm back to my old self now that I haven't used hydroxyzine in 15 years. Sarah said she had bad effects from hydroxyzine. Hi, Andrea. Nice to see you too. Sue says she's still having trouble hearing me. Can y'all hear me well? Let me look at my mic here. Well, everything looks good on my end. Sherry says she also had the hydroxyzine side effects of very vivid dreams. Sue, I'd love to hear how you're doing. Sue is one of the far more interesting cases of IC. Carol, cancer surgery? Yeah, hon, I had early uterine cancer 3 years ago, and I had to shut my office down for about 4 months. Oh, scared the hell out of me. And then right before Thanksgiving this year, I had another cancer scare. This time a breast cancer scare. They thought they found a tumor in my left breast when I had my mammogram, but they called and said, "So we think we have an issue in your left breast. Would you please come back in?" And I'm like, "Okay." Your heart drops. Uh, and then they said, "But we can't see you until before Christmas." It's like, wait, you've given me this news literally, and you're asking me to wait 3 weeks through the holiday season to wonder if I have cancer? Oh hell no. I called them the next day, and I called and called and called and called until they had an opening. And no, it wasn't anything. It was just fluid. Praise God, hallelujah. Woo. That was hard. Look at how red my hands are. Why are my hands so red? Weird. Harriet says, "I am unstoppable." Girl, that's what I want to hear from you. That is the perfect I am statement. Hi, Lori. Hi, Deborah. Angie says she can hear me. Deborah says she can hear me just fine. Notebooks don't have the volume of laptops. That's the only way I can watch. But okay. So I can't fix that. Angie says, "Love my Bladder Smart multivitamins. Just one a day, and I've noticed a big difference." Girl, woohoo! So, you guys know that we have for years we carried multi-right low acid multivitamins. I'm discontinuing those. I'm just not happy about a number of things associated with that, particularly just with the company. And so we brought on a new line of low acid multivitamins called Bladder Smart. Bladder Smart. And so at our meeting right before Christmas, I gave away, I think, 12 bottles of this to people for their thoughts. So the cool thing about this is we took out some of the minerals. We took out a few things from as compared to the multi-right formula, things that some patients couldn't take anyway because of other health conditions. So we really kind of cleaned the formula up, uh, uh, really took a very, very close look at the source of the ingredients, yada, yada, yada. This is made by Natural Approach Nutrition, the same company that makes Bladder Builder and Bladder Rest and Peora. So if you wanted to consider a multivitamin, you have to do a low acid formula if you're IC subtype 1, IC subtype 2, which are Hunter's lesions or bladder wall driven. Then there's really only 3 low acid multivitamins on the market: Multi-Right, Bladder Smart, and then Desert Harvest Aloe has its own low acid vitamin that they came out with last year. But I think this one is going to kick all the other ones. I'm excited. I'm really, really excited about this one. This is one of the other projects that we were working on all year last year. And and I am happy to report that Cysto Protec is back in stock. Hallelujah. Holy moly, my friends. Took long enough. Took long enough. So here you go. This is a new bottle of Cysto Protec, and the way you know it's a new bottle is because it's going to say Mylan on it. It's going to say Mylan on it. And now, for those of you who don't know, Cysto Protec was for more than a decade the top supplement used by IC patients. But unfortunately, it came out with a cancer warning last spring due to the presence of titanium dioxide in the capsule. Titanium dioxide is a food coloring that, if you breathe it in, can cause cancer. If you swallow it, it is considered safe, although that's changing. Obviously, if you put a cancer warning on a supplement that says warning cancer and reproductive harm, not too many people are going to want to take it, myself included. And so finally, they have reformulated it. And so let me see here. This is an old bottle with a cancer warning. Let me just open this bottle real quick. I wanted to compare the pills, and I actually haven't done that yet. And I don't think I have another open bottle of Sister Protect. All right, hold on. See if I can get this security seal off. Come on. Let's see here. Here we go. Okay. So this is an old bottle that says Meta. This is a new bottle that says Mylan. Okay, so that's the new bottles that don't have the cancer warning. So let's take a look. So this is the old bottle, opening it up. Oh yeah, huge difference. Huge difference. Okay, so the old pills were brown, right? The new pill is red. Okay, so this one it has no titanium dioxide in it. You can tell if you put white in this, it's going to turn brownish. This one already has white in it, which is titanium dioxide. So the brown pills are the ones, or the brown capsules are the ones with the cancer warning. The red ones are the good ones. Okay, so that's pretty cool. So you can get that now right on our website, and it is $47, $46.99, something like that. And we'll be sending it over to Amazon next week. So you'll be able to get it on Amazon too. Fair warning though, Amazon is going to be at least $10, if not $15 more expensive. It's always cheaper to buy it from us directly. That $10 to $15 is Amazon's cut. And we already have prices so low on everything. I always try to negotiate the lowest prices that I can for our store. And so if it's on Amazon, it's going to be more expensive. All right. So Angie, I love that you like Bladder Smart. Hello, Jean in the United Kingdom. We have many problems with our health service. I have had many tests. I'm in pain most days, have been discharged saying I'm fine. No, whether it's IC or embedded infection, nobody is helping. Jean, what about Bladder Health UK? Have you reached out to the nonprofit that works with bladder diseases in the United Kingdom? Have they offered you any help? Have you been to any of their support group meetings? I think that would be really interesting. See if they can help you with that. You know, I'm more than happy to try to talk with you outside of meetings. You can sign up for coaching. You can give us a phone call. I have been known to Skype. I Skype in the middle of the night, my night, to England to help patients over there. So I'd be happy to do that. I'm sorry, guys, my top is being weird. Okay. Also, we have a lot of discussion right now, especially over in the United Kingdom, about the role of chronic embedded infection, and is embedded infection a potential cause for IC? And if you've attended any of these meetings in the past, you know that I do not support any broad strokes. We certainly cannot say that everybody has one form of IC or another form of IC. If there's one thing that we're really clear on, is that there's a lot of diversity out there. Some of you have pelvic floor muscle injuries. Some of you have nerve injuries. Some of you have viral infections triggering Hunner's lesions. Some of you have estrogen atrophy. We cannot make any bold statements that every single patient has this or every single patient has that. Where the IC world is right now is in exploring and working and validating the role of subtyping. We need to understand your unique presentation of IC to focus on the right therapies for you. Right? To focus on the right therapies for you. A one treatment fits all approach simply does not work. So, is there a small group of patients who have potentially what we would call a chronic embedded infection? Yeah, I think so. It's not big. I think it's a very, very small group of patients. And if your next generation urine testing identifies some sort of pathogen, I think that that's worth exploring. The challenge with what is being recommended by people who are supporting this theory is using long-term antibiotics. And interestingly, we just had a research study presented which showed, and I've got it here on my computer somewhere. I wasn't going to talk about it today, but I will. Which which revealed for the first time that E. coli has an important role to play in the suppression of fungi. Remember, we've got this biome, we've got this really rich, diverse community of bacteria that lives in our bodies. And it's lived in our bodies for millions of years. And we, as humanity, are just kind of getting to the point right now where we're starting to understand little tiny bits and pieces of what these bacteria do for good and for bad. Some bacteria, for example, produce the food that nourishes the cells lining your gut. Human body does not make this food at all. And so we need bacteria in our body to survive. We need a very diverse population of bacteria to survive. And when you take long term antibiotics, you're basically killing the forest. You're taking a flamethrower to the forest of your biome. And the only thing that survives is potentially things beneath the soil or potentially beneath the skin. So anyway, if there's enemy 101, it's E. coli, right? People are really worried about E. coli. And yet I had a next generation test. I had a tiny population of E. coli. And I chose not to treat that because I had no symptoms from it. Now, this new research study came out which showed that E. coli actually helps to kill fungi, to kill candida. And so again, we can't so maybe that little tiny population of E. coli has a really important valid role in the human biome, the bowel biome or the bladder biome. And if we kill it all, how are we messing? We don't even understand at this point in time the ramifications of long-term antibiotics and what that is potentially doing to the body. We don't. We don't. Karen says, my doctor's switching me from Detrol to Miratrix, but it doesn't seem to be working. Give it time, hun. Number one, you got to give things time. Remember, Detrol is an overactive bladder medication that is an antispasmodic. So it works by controlling spasms of the bladder wall. Miratrix is a much safer formula. Detrol has been linked to dementia. If you take it every day for 3 years or longer, any of the bladder antimuscarinics that supposedly that substantially increases your risk of cognitive decline, especially as you get older. So making that change is a good thing. But I think the question is, what we have to find out is, what is your subtype? What is your variant? Is that an appropriate therapy for you? Is there anything else that has been missed? Hello, John. Sue says, belladonna suppositories work amazing for your pelvic floor spasms. I use them post-op surgery. Why won't the doctors prescribe them for flares? They work better than taking Norco. Well, they're opium, belladonna opium suppositories. Opium can create an addiction too. But Sue, hun, you guys, Sue has been in our support group meetings now for some time, and I know she's been okay with us talking about it because she's talked about it. Sue has a really interesting case of IC because she was diagnosed with IC, and she did a lot of bladder therapies but none of them really helped. Um, and um, and what was interesting is the therapies that were you should have really helped, like pelvic floor physical therapy, actually made her worse and gave her more pain, right, Sue? And I mean, they kind of felt better, but they also were painful when they did them. Anyway, to kind of fast forward, what they have found is that Sue has a really interesting formation of scar tissue in her pelvic floor muscles, probably from falling off of a horse, right, Sue? And so it makes sense that the bladder therapies would not have been as effective or effective at all, given the fact that her pathology is really outside of her bladder, more in her pelvic floor. Sue, girl, I wish total healing for you in 2020. You of anybody, I want you to be able to stand up every single day and say, I am strong. Because you know what? You are hella strong. You are so strong already. Think of everything you've gone through. And the best part now is now we know why. Now we know why. And I got your back. I mean, you know me. I really care. I really care, and I want to see you feeling better, and I really hope that that's happening. But in the meantime, making a case for the BNO suppositories, would be interesting. Talk to your doctor about it. You know who we're talking about. Wendy says Meavertrix takes 6 months. Oh, ooh, and her husband has been so sick it even attacked his eyes. Holy moly, girl. Okay. I will defeat this cold. I will not get this cold. If I get this cold, my body is going to fight it really, really hard. I am strong. I am powerful. I am prepared. Use your I am statements. Nancy, just diagnosed with bronchitis and a sinus infection. Holy moly, girl. You're concerned about prednisone, and it looks like they want to give you an amoxicillin. You got to do what you got to do, because once you got bronchitis and we're looking at lung function and also a sinus infection, make sure you do your probiotics. Anytime you take the antibiotics, make sure you do your probiotics at the same time, not exactly at the same time, because the antibiotic will potentially kill it. Wait 6 hours, 8 hours, do it the opposite time of the day. But try to repopulate your body with good beneficial bacteria. Sue says, right now I've got Vicks on my chest, honey cough drops from burnt bees in my mouth, took Mucinex, and have a vaporizer on. This sucks. 2 weeks post-op from your inostom surgery. Life. Holy moly. Hi, Kareen. Hi, Sandy. Erin got her flu shot. Yeah, I always get my flu shot early. Hi, Jennifer. And now that's interesting. Jennifer says it helps with your frequency, but it tears your stomach up. Now that's really rare. So Jennifer, it would be interesting to know, is it hydroxyzine hydrochloride, Atarax, or hydroxyzine pamoate visceral? Hydroxyzine pamoate visceral comes in a capsule, and so it should pass through your stomach before it starts to dissolve. So you might want to consider trying the visceral variation of hydroxyzine first if that isn't what you're already taking. Hello, Jamie Osborne. It's always nice to see another Osborne. John says, are there alternatives to antihistamines that don't have prostate side effects? Yeah, quercetin. If you want an alternative that's over the counter, you're going to look for a non-citrus sourced quercetin, a quercetin that comes from the Sephora plant, which is a quercetin that you're going to find in Cystro Protec or in Bladder Builder or in Bladder Rest. That would be the over-the-counter variation of that. Carol says she's sick of having IC. I hear you. Girl, Sue, so you had your second stage interstim surgery. You're seeing more volume, less pain. Awesome. And I think it's great that you're going to be going back to doing that pelvic floor physical therapy. Yeah, and at least now you know to work around the scar tissue, right? Nanette says, I hear Dr. Whitmore is going to be practicing in New Jersey at Verta Hospital, practicing with the pelvic floor group. Okay, hey Nanette, if you got more information on that, that's fine. I will tell you that Dr. Whitmore was seen in Europe at the ESSEC meeting. And I asked the organizers of the ESSEC meeting if they could tell me where she was practicing. And I think someone mentioned the Verta group, but they couldn't give me anything specific. Jennifer says, I'm scheduled for a spinal nerve block at the end of this month. Do you find many IC patients benefit from this? And if so, what symptoms? Well, hon, it depends upon what you're trying to accomplish. And it depends upon where it's done at the spine. Normally, spinal nerve blocks are about controlling pain. Again, I think it's extremely important that you focus on your subtype or your variant of IC, Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, central sensitization, and we start looking at your therapies based upon your potential subtype. So nerve blocks, I mean, power to you. If you're in extreme pain and if it helps with your pain, I say go for it. But anytime you're doing a spinal procedure like that, there are risks, and you definitely want to talk to your doctor about those risks. Thank you, Nanette. Nanette says Dr. Whitmore should be taking appointments in February or March. Kathy says, "Hi, Jill. My husband and I both have IC. Is this unusual?" Um, it's no. I'm not going to say it's unusual. I'm going to say that there are probably a lot of couples where both the husband and wife have some degree of urinary symptoms. Usually for the guys, it's usually some form of chronic prostatitis. Um, but we also know that chronic prostatitis can have very similar subtypes to IC, including pelvic floor injury, etc. So I think the good news is that you've got great support here. You guys understand each other. You understand the limits. You understand the importance of diet. You understand pain control. Then that's just a fantastic opportunity for you, hon. But it would be very, very interesting to explore your subtypes. Do you guys have the same subtype? Cynthia says, what's my take on the urinary antiseptic Euro MP?" Let me look it up. Oh, it's just a methylene blue. It's just like Euro blue. It's just a methylene blue product that it's got methenamine in it. It's got aspirin in it, which will salicylate, which is related to aspirin. It's got hyoscine as an antispasmodic drug or antispasmodic effect. Methenamine is an antibiotic. I mean, hun, it's not a treatment for IC at all. It's not mentioned in the IC guidelines as a therapy for IC. It's kind of uh, I guess the word that's kind of coming to mind is it's uh, like a first level intervention by an uninformed care provider. If you've got frequency urgency, they think you've got infection, they will often throw you on a variation of a formula like that. Um, uh, but if you've got, if it's not effective and it's a month or two down the road and you're not doing any better, then you want to go back and have a proper diagnostic workup to see if we can find something else. Like, do you have fibroid tumors? Do you have Hunner's lesions? Do you have a fungal infection? There are lots of confusable diseases. Caroline says, can I take Mirbitric instead of amitriptyline? No, they're not the same. Holly says, I was just diagnosed with macular degeneration. I took Elmeron off and on for a few years. Been off of it for about 2 years. Doctor's not sure if it is due to Elmeron or not. I'm scared to death about losing my vision. Holly, I'm so, so sorry, hun. I'm so, so sorry. I guess the question is there any macular degeneration that runs in your family? Because it can be hereditary too. Also, getting back to the woman whose husband also has IC. I'm just going to throw it out there. Listen, if you guys have terrible diets and you were drinking a lot of soda and coffee and all that sort of stuff, that could explain why both of you have an irritated bladder, right? Allura's advocacy joined. Hello, Allura's advocacy. Kelly says, is this still live? Yes, it is. So Allura is ELLURA is a medication that has seen tremendous success in the prevention of urinary tract infections. And it is something that I have a family member who uses Allura faithfully every day. The challenge with Allura, if there is a challenge, is that it is expensive. And some people simply cannot afford it. Let's go down to YouTube here for a moment. So, guys, if I'm looking up here, I'm looking at Facebook. If I'm looking down here, I'm looking at YouTube because we're simulcasting here. Brian says, I have a flare up when I'm attacked by someone or in a heated discussion. Any advice to give? Well, honey, anytime you're under stress, what's going to happen is you're going to subconsciously clench your pelvic floor muscles. You know, that's the fight or flight response. You are basically in a mini fight, but your body doesn't understand that it's not a fight that you have to run from, but that stress response that your body is going to do have very natural response to tension. And one of the things that it does is it tightens pelvic floor muscles. Another thing that it does under extreme stress is it the nerves release a substance called substance P, which is irritating to the bladder. And so that would explain why you might be having a flare when you are under severe stress. Kenny says, what therapies for pudendal neuralgia? The therapy for Kenny, the number one therapy for pudendal neuralgia is pelvic floor physical therapy. We got to figure out why your pudendal nerve is activated. Why is your pudendal nerve being triggered or compressed or inflamed or irritated? And normally, what we see in pudendal neuralgia is very, very positional symptoms. Okay, so Kenny says, I have all my pain on the left rectal wall all the time, more severe when sitting. Okay, so Kenny, anytime any patient has a spot, a location, like for you on the left side, that's where you've got to spend the bulk of your time with your care provider. What structure is on the left side that is triggering that pain? And so the odds are you're like most of the guys I work with, where you have at some point in time sustained an injury down there, that you may have fallen on your left side, fallen on your tailbone, broken your tailbone, whether you were a motorcycle rider, bicycle rider. Do you remember any traumas on your left side? You remember falling? Like, I was working with a gentleman, it was really interesting, on Friday, who I'd been diagnosed with IC 5 years ago. His symptoms were very, very intense. And, so we're having this discussion. I'm asking lots of questions about his history. And I basically said to him, most of the guys that I work with, we can almost always go find some sort of triggering event, some sort of trauma to the pelvis. And he's like, no, I didn't have any. We're talking another 15, 20 minutes. And I'm like going, are you sure? Sometimes we see broken tailbones. Have you ever had a tailbone injury? And he goes, oh my God, yes. Somebody pulled a chair out from behind me and I fell on my tailbone and I had pain for 2 to 3 months. This was right before his symptoms began. Classic case of IC pelvic pain, pelvic floor dysfunction, pudendal neuralgia beginning after a pelvic floor trauma, usually around the tailbone. So Kenny here says tobogganing maybe. Do you stretch it out? No, hun, you don't necessarily stretch it out, because what happens is a muscle that's injured
gets weakened. It becomes weak. The structure is physically damaged, so it becomes weak. And then when it gets weak, what happens is it sometimes gets tight. Or you could have scar tissue like Sue from falling off of a horse. And so it's very, very important first that you have a proper pelvic floor assessment. You can't figure this out on your own. Listen, your pelvic floor muscles are this really interesting complex of muscles that go from left to right, front to back, low to high. And so what they have to do is they've got to look at your structures on your left side. It could be your piriformis, it could be your levator ani, or honestly, it could even be your SI joint. Your SI joint might have gotten messed up in some way. That we see that frequently. Anytime a patient has chronic muscle problems, and again, I don't remember who it was. No, I think it was the guy that I was working with, who it feels did physical therapy. Was that him? Okay, well, somebody I talked to on Friday. Um, did physical therapy, felt good for 24 hours, and then bam, the next day, the symptoms were back. Oh, yeah, it was him. And he was still going to the chiropractor, and chiropractor felt good for 24 hours, and then bam, the next day, everything was back. And what I said to him, I've got to say to you too, and that is anytime we see muscles rebounding in a tension pattern, anytime we see muscles that continue to be tight and stressed and provoked over and over and over again, we always want to examine bony structures because normally muscles respond beautifully to physical therapy. I mean, beautifully to physical therapy. But if you're not responding beautifully to physical therapy, we have to try to understand the environment of your pelvis. Is there something else in your pelvis that is keeping those muscles tight, keeping those muscles dysfunctional? And for me, it's my SI joint, which ironically yesterday was killing me, and I'd put my SI belt on to hold it together. Your SI joint, you've got two joints. So if this is your pelvis, this is your hip. There's a long vertical attachment, for lack of a better term, of these two bony structures, and it's meant to be very stiff. This is not supposed to flex like this, right? If it flexes like this, then what happens is the muscles which hold it together, the piriformis muscle, starts to strain and becomes overworked. Um, so the challenge with stretching it out over and over and over again is you might weaken the muscle. We don't want to do that. So Kenny, we got to understand what the hell is happening down there first. And then based upon that, they might actually have you stretch first, but then more importantly, do strengthening. If your muscle is weak, we got to relax it, but then we got to strengthen it. We've got to uh, help it support its role. Weak muscles don't function well. We have to get them normal again, but we also don't want to over strengthen them so that you're in a chronic tension pattern. It's a little tricky. Kenny, listen, we got a really good book you should get. Let me get it. Oops. Ending Male Pelvic Pain. And this is all about pelvic floor, muscle, all that sort of stuff. You would find this, I think, very, very, very helpful. So Kenny says he had an MRI, X-ray, etc. Can't you had the internal examination. The doctors can't find anything thus so far. Anyways, thank you for taking the time to respond. So the good news is if you had an MRI and they couldn't find anything, then the assumption here is that your bony structures are probably pretty good. So we've got to get right back down to muscle function. So you may have outclassed or out challenged the local pelvic floor physical therapist in your area. It would be perfectly reasonable for you to up your game and go to somebody better, somebody more skilled. What state do you live in, Kenny? Just a state. Or you could just say East Coast, West Coast, Middle America, and I might be able to give you an idea of who to go to. Going back to Facebook here. Happy New Year, Kristen. Angie says she has scar tissue too. Kenny, Canada. Okay, okay. Well, then, it would be, unfortunately, the pelvic floor physical therapy community in Canada is fairly limited. My suggestion would be, and Kenny said, I read the book Headache in the Pelvis. Didn't find it's not helpful. It's not a book I recommend at all. Ending female pelvic pain would in my opinion, I mean, ending male pelvic pain would I think would be a better choice for you. I Most of the patients in Canada, if you're in central Canada, would come down and see Ken Peters at Beaumont Health in Royal Oak, Michigan, which is northwest of Detroit. So if you're in Ontario, if you're anywhere in there, you can head on down to Ken Peters. He is a master diagnostician. I just sent I send really, really complex cases to him because he's known for his kind of nuance of diagnosis. He's got a real level of kind of intricacy in terms of um, being able to differentiate, X versus Y versus Z and what could be triggering your pain. I mean, listen, you deserve the best. And unfortunately, in Canada, you're challenged. If there's any way you can come down even once and see Ken Peters at Beaumont, or if you're, yeah, perfect, you're close. And the thing too is Curtis Nickel, the top doctor in Canada right now, apparently is retiring, and I don't know who is replacing him. Angie says, same with me on scar tissue. Had a ton of it from my ribs down, and my colon was stretched and attached to my left hip bone. Oh, God. Holy moly. Suffered with that pain for 8 years before a doctor finally did a laparoscopic surgery and found it. My pelvic floor was so compromised. Since surgery 2 years ago, lots of physical therapy, including dry needling. You still have tight pelvic floor muscles, but you are so much better. Awesome. That's what I like to hear. I've worked with two people, a man and a woman, who, as children, were run over by cars, and they were there. Literally, the car went horizontally over their hips and crushed everything, and then the car kind of went diagonally over one side. And those were catastrophic injuries. They were in their 40s or 50s when I worked with them. And the legacy of those injuries were really significant pelvic floor and muscle damage that ultimately led to bladder dysfunction. I mean, it's a miracle that they survived, but the long-term consequences of injuries like that are, you know, devastating at times. Louisa says, I constantly have a burning sensation, new with IC. How do I know if the burning is your bladder or your urethra? Well, number one, where is it located? Where is it located? And number two, the more important question is do you feel burning as your urine is coming out of your body? Does your urine feel hot? Does it feel like it's burning your skin, like your vulva? If it does, then you've got estrogen atrophy. It's probably due to estrogen atrophy that your vulva is dry because of the loss of estrogen, and so is your urethra. That would be the more common thing. John says, does bladder builder help with urethral pain? I think anything that provides a coating effect could help with urethral pain, whether it be bladder builder, bladder rest, Sister Protect, or Desert Harvest Aloe. That's a situation where Desert Harvest Aloe kinds of shines because aloe is very calming and soothing. And we had a young boy, a very, very young boy, diagnosed with IC. He was like 4 years old. And all he could say to his mom was that his pee pee hurt. And between the doctor and the mom, they were fine. They were really able to figure out that it was really his urethra, and it was uh, aloe that helped him with that tremendously. And I haven't heard from them in 15 years, so I would assume that whatever was going on is fixed. Karen says, can a bladder flare up cause groin pain? The answer is yeah. Anytime your bladder is in pain, your muscles are going to respond in a guarding reflex and get tight. And so there's very good chance that number one, your muscles are tight and that's triggering some groin pain. But I think another thing that you want to look at is touch the lymph nodes. So like, of course, I'm wearing jeans today, so that doesn't really work. Okay, but so like, so here's the top of my legs, right? There are a series of lymph nodes in this area, right along this edge. If if your lymph nodes are swollen and tender, then you might have an infection going on. My lymph nodes every now and then will swell and get tender. Usually it's because of a pimple. You know, ladies, you know what I'm talking about, right? The little pimples you get. Okay. I have a really good blog on my website. So if you come on over to icnetwork.org, and there's a blog called The 7 Causes of Urethral Pain. So just search for urethral pain and go through that list. There are a lot of potential things that can trigger urethral pain. I will tell you, one of the things that triggers urethral pain for me is laundry detergent. If I put on a pair of underwear washed in sheer or Tide, within 5 minutes, I will have urethral burning. Always been that way. And also, fabric softener and dryer sheets. You know, if you're one of those people where you like your clothes to come out with a strong scent, what you're not understanding is that that perfume and those chemicals are now saturating the cotton even after it's dried and are off-gassing irritating chemicals. And especially if you're menopausal or you have sensitive skin, you're a redhead like I am, your skin is probably going to react to those chemicals in some way. So you definitely want to go free and clear, no fabric softener, nothing like that. You got to be really careful there. Diana says, hi everyone, I have a very bad cold, lots of coughing, took mucinous cold, flu and sore throat. That's what it says on the package. Do you think I won't have a flare with that? No, I don't think so. I don't think you'll have a flare from that. You know, drink plenty of water, add some honey to it, hot water with honey. Diana, you could rewatch this, but I posted earlier a link to our cold and flu strategies. Take a look at that, but just know that it's all about honey. It's all about honey. Do anything you can with honey. Honey cough drops, honey, a hot water with honey, and honey throat drops. I held a whole bunch up. Look at Paul's honey cough drops, Burt's Bees honey throat drops. I really like Luden's cherry drops. And where's the honey candy I have? Oh, here it is. Something like this. Honey's throat drops. All natural, extra strength cough drops. And when you suck through it, there's a big goob of honey in the middle. These are definitely going to be the most bladder friendly for us. Karina says, what do you think about oxalates? I went on a low oxalate diet. My bladder is all of a sudden so much better. I think that's awesome, hun. Oxalates absolutely can be irritating to some people. No doubt about it. No doubt about it. And so if going low oxalate improves your symptoms, what does that tell us? It tells us, number one, that your bladder is a bit more sensitive. And number two, you've got some control over it. I actually, over the summertime, I will tell you, I live on blackberries, but berries are considered high oxalate, right? I love blackberries, and I usually get organic blackberries. And yesterday they didn't have organic. I got regular blackberries, and I had about 10 before I went to bed, and I had a reaction to it, which is really rare for me. My bladder is normally so good. And I'm thinking either it was a chemical on the blackberries or it was oxalates. That I shouldn't have done it right before I went to bed with no water as a follow up. Kelly says, you just found out that you have kidney damage from steroids that they put you on. No one told my primary care provider doctor. Oh, girl, I'm so sorry. Oh, crap. Sorry, I clicked a button and I lost that message there. Kidney damage because of steroids they put you on to control your IC. No. Can't feel your feet. How is this? Girl, oh, honey, I'm so sorry. One day at a time, one day at a time. She says, is there any advice that you can give me? Number one, breathe. Come on in. Hey, man, it's a support group meeting. Let's do it. Let's take a couple deep breaths. In for 3, out for 3. One more time. In for 3, out for 3. It's gonna start, girl. Number one, you gotta build up your knowledge level so you can have a really good discussion. Um, uh, go to the internet, go to RX list, look up the medications you were taking, look at the side effects. Make sure you understand the depth and breadth of the potential side effects that you were taking, even if you're not taking them now, because that will help you have a better discussion with your doctor about whatever's going on, right? That's going to be number one. Number two, I know it feels like this is all connected to one thing, but it might not be. Separate these out in your head. So you've got neuropathy in your feet. I've got neuropathy in my feet. That's definitely not related to my IC. That's related to me being an athlete. Is it related to diabetes? Possibly. It could be. Um, you're going to have to work on your diabetes, and ultimately if you have out challenge your local doctors, ask for a referral, go to somebody better, go to somebody more skilled. You deserve the best. You deserve the best medical care providers. You have the right to request a second opinion. I don't know about the cyst on your kidney. You definitely want to get that checked out. You want to have a biopsy. I know it's hard. I know you're overwhelmed. I know you feel like the world is against you right now. And I know that you're just sitting there, just like I was as I was facing my uterine cancer, stunned, agonized, scared. You can do this. You will do this one day at a time, 1 hour at a time, 1 minute at a time if you need to. Ask for help. Tell your family you're scared. Ask somebody to be with you at every appointment. Don't suffer in silence. Get the help that you need. Educate yourself, build your knowledge level so that you can have a really good discussion. And ultimately, in the end, now listen, you don't know what it is. Don't assume the worst. Like they thought I had a cancerous tumor in my left breast before Christmas. Scared the hell out of me before Thanksgiving. And it turned out it was nothing. It was just a little pocket of fluid. That could be the same for you. So carry an open heart. Um, you're not God. You can't predict the future. All you can do right now is focus on today. So on today, do anything that you can do to give yourself comfort. anything that you can do to give yourself strength, anything that you can do to build yourself up. Affirmations, carry hope in your heart. If I can do it, you can do it. You can do it. I believe in you. I believe in you. Listen, when you walk into your appointments, Kelly, I want you to visualize that you've got 100 people standing behind you. We are standing behind you. We are standing with you. We are sending you strength. We are sending you love. We are sending you support. We are sending you courage. You are not alone in this. Hi, Christine. Pauline says that she's praying. And prayers work. Prayers work. Hello, Karen. Hi, CM. Sue says, I fall into 4 subtypes, but never got the right diagnosis for 25 to 30 years, so none of them were treated correctly. Yeah, see? Exactly. Exactly. Holly said, okay, so Holly did InnerStim with Ken Peters and it did not help. It does, remember, Holly, number one, it depends upon your subtype. And number two, InnerStim does not work for everyone. It doesn't. So I hope you've had it removed and it's time for you to revisit your diagnosis. Let's see what we can do to figure out what the heck is going on with you. Don't feel bad that it didn't work. Nothing is going to work for everybody. But you gave it a good try. Let's move on to other things now. The new year. CM says, I need a West Coast, British Columbia IC doctor referral. You can check our database on our website. By the way, and I have to find it. Someone sent me a resume to help us with their doctor list, and I don't remember your name off the top of my head. I will get back in touch with you this month so that we can do that. You guys, I only hire IC patients. Because I thought that I would not, when I was diagnosed with IC, I couldn't imagine. I mean, I felt like I would never do anything again. When you're in terrible pain, you can't imagine doing anything again. I want you to know that you can. You have a role to play. You have contributions that you can make with or without IC. And this year I'm going to be hiring more people. I want writers. Anybody who loves to write. But I don't mean writing your patient story, because we have a lot of patient stories already, but writing about different elements of IC, different stories that I might give you. If you're a writer and you're looking for an opportunity to write, please reach out to me. ICnetwork@mac.com. We have a fabulous writer in Stacy Shannon. She's going to continue to write for us. But my time is getting more and more limited. I need more writers, not only for our website, but also for our magazine. I also need I need a really, really good social media expert. I've got one person in mind who's an IC patient, but anybody else out there, if you have a genuine interest in being professional, and doing a very high grade professional medical outreach through social media, I want to talk to you too. Sharon says, what subtypes does InnerStim placement help? You know what? Boy, isn't that a great question? So it could help. So it's all about symptoms, right? InnerStim is about symptom control. So InnerStim can control frequency, urgency primarily. So anything that gives you frequency, urgency, so subtype 1, subtype 2, subtype 5. Although if you got subtype 1 Hunner's lesions, we want to make sure that those Hunner's lesions are treated correctly, right? But it's also thought that InnerStim might actually help very, very tight muscles release and or help remodulate nerves. In Chris Payne's article on the subtypes, I believe that he was really focusing on pudendal neuralgia potentially. So it's all about symptom management. Here, I got to open this window a little bit more. Hold on, which means I'm now going to be looking down a little bit. Christine says Manuka honey has antibacterial and antiviral properties. Yeah, go for it. Louisa says, I use liners with no scent. Is that okay? Honestly, it depends on how old you are, Louisa. If you're young and you have lots of moisture and mucus down there, that your body is keeping your tissues nice and soft and fresh, then you might be able to get away with panty liner. But when you're older and things start to get a little bit drier, you're going to end up with friction. And panty liners might not be a good idea when you're older. I have stopped wearing them myself. I didn't, what is this about this industry that tells women they're dirty and we should be clean down there and yada, 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 and moisture is bad and yada, yada, yada. There's kind of this, we kind of get into this perception that we have to use these products to be healthy. And I thought that I had to wear a mini pad. I don't even know why. I didn't leak. Anyway, now that I'm not wearing them, I actually feel a lot better down there because I'm not getting any chafing, any dryness, any rubbing. Sue says, I've been using pieces of cotton with vinegar and natural oils to make my own dryer sheets. So far, it has not been bothering me, but there you go. Sounds good. You can also get, there are these bundles of wool, little ball of wool that you can put in your dryer. Hi, Tammy. Kelly says my doctor is supposed to be one of the best. He's so busy being the star IC doctor, he doesn't do much doctoring. It's not that. It's that the best doctors, I mean, think about the life of a national doctor. So a patient starts locally. So here I am in Santa Rosa, California. I go to my local urologist. He doesn't have a freaking clue. They send me to UC San Francisco and I'm there for a year, right? And ultimately, in the end, they were able to help me. But if they hadn't been able to help me, my next stop would have been a national doctor. National doctors every day get the hardest patients. They get hundreds of referrals every day for all these very, very complex patients that other doctors cannot figure out. And it takes a toll on them. I won't say his name, but one of the doctors that I've worked with very, very closely, as he got older, the stress really started to show. And he started out very bubbly and happy and encouraging. And then all of a sudden, I got a report from, somebody who said that he was really kind of irritated one day. He had been in surgery for hours. He was exhausted. Doctors are human too. And the toll that, and you may not understand this, but doctors commit suicide too. And urologists are one of the highest groups of patients where doctors get massively overstressed and have taken their lives because of their stress level. So don't think that they're not trying. The other thing that the top doctors are doing is they're often representing the IC community at international meetings and they're out training other doctors. And I think of the top 5 doctors in the country who are all friends of mine. They are out and about working their asses off, trying to get other doctors up to snuff, trying to get other doctors knowledgeable so they don't have to make the referrals to them. So it's not that I've only met one doctor who I thought, kind of in the large international IC community of, there are probably, I'm going to say 400 doctors around the world that I would consider real specialists in IC. I've only met one who I thought didn't care about patients. this is and remember too, what do I say? What do I say to everybody? When you go to a new appointment, a second opinion, never ever walk in and say, I've got IC. I want you to walk in and discuss your symptoms. Say, okay, doctor, I have pain on my left side down by my rectum. Can you help me understand what down there could be triggering this pain? Or I have pain that gets worse when I do this and gets better when I do this. Or I have pain that gets worse at the end of the day, but it's fine in the morning. Or I've got pain that I'm fine when I sleep, but when I sit on the side of the bed, it hurts. Your ability to talk about your symptoms is going to greatly improve and enhance any appointment you have with doctors. I don't want you to walk in and start crying. I don't want you to walk in and say you've got IC. I want you to walk in ready to talk about your symptoms, where they're located, and focus that doctor on your anatomy. Think of Sue, who's in here right now. Sue spent 30 years doing bladder therapies and they didn't work. And when they finally when they finally did an MRI or a CAT scan, I don't remember which it was, of her pelvis, it wasn't her bladder, guys. It was scar tissue, deep, thick scar tissue woven through her pelvic floor muscles. Sue was a horseback rider, a very, very good, talented, gifted horseback rider, and she took her more than her fair share of falls. And clearly, that scar tissue has been there for a long time, but all the doctors missed it. Everybody missed it until recently. And so we want you to get your doctors to focus on studying your anatomy. You got to study your anatomy first. Is there anything wrong with the bony structure? What is the health of the muscles? What is the health of the nerves? What is the health of the spinal cord? I was working with another patient like on Friday who doesn't have an arch in her back. She doesn't have the proper arch where your tailbone kind of goes like that, right? And she had sustained a really severe injury. And I did a profile of another patient who had exactly that same thing. And once they were able to restore the proper position of her bones through chiropractic and pelvic floor physical therapy, her symptoms improved dramatically. Andrea says, Jill, I tried bladder rest only once. I had frequency and a bit of irritation in my bladder. Want to try it again, but you're so scared. Well, hun, you know what? I'm just like you. I hate trying new things. I hate trying new things because I'm really super sensitive to stuff. There's no doubt about it. You've only tried it once, one pill, right? So try another one. Give it a shot. Just give it a shot. Take it with some food. I don't have anybody with people who've called me about bladder rest. Some people think it's much better than Sister Protect. Others prefer Sister Protect. I think out of the maybe 2,000 bottles that are out there so far, we might have had 3 or 4 people call to say they thought that it triggered symptoms. The vast majority tolerated it well. You could have been ovulating that day, whatever. So at least give it another shot. You got the bottle. I mean, talk to your doctor. I mean, the thing is, you didn't have any allergic reaction to it. You didn't have any difficulty breathing or anything like that. You had some frequency and a little bit of irritation. We don't know if that was caused by the supplement or something else going on. Christina says, I have an InterStim. It does not help with the pain. InterStim is not approved for pain management, Christina. It never was. It never was. That's the thing that bothers me is that here, hold on a second. I need to get this real quick. All right. I need to take this out of here. All right. You know, some doctors make a lot of big promises about InterStim. They say it'll help all of your symptoms, your frequency, urgency, pain, yada, yada, yada. But when you actually look at the FDA approvals, it's not for pain. It was never meant. Well, I think they hoped it would help with pain, but the research studies didn't prove out that it helped with pain. Debbie says, what do they have for bladder installations? The most popular bladder installations right now are rescue installations. So they're either going to be heparin and lidocaine or Elmeron and lidocaine, or for patients who are intolerant to lidocaine, Marcaine. Those are definitely the two most popular supplements. Installations around the country, around the world. DMSO to a much lesser extent now. And I think the reason why is because DMSO um, doesn't break somebody out of a flare like a rescue will. The reason why they call it a rescue is because patients in severe flares can walk out of the doctor's office pain free after a rescue. Over on the IC Network website, if you go into treatments, bladder installations, which is step 2 of the IC treatment protocol, we've got all the formulas we could find that had been published in research studies that you can look at. Andrea says, I will try again. She says, taking Peora, haven't had intense pain since you've started the Peora. Woohoo! That's what I'm taking too. I'm taking the Peora, but I'm taking the Peora. My bladder, I don't have bladder pain. What I have is a lot of skin pain, just central sensitization. And does anybody else out there get a sore tongue? Like the tip of my tongue often just gets really, really irritated. And so that kind of, I was doing a lot. I was doing, I did something hot and burned my tongue, and then I drank a couple of things that really irritated it worse. And it's taken time for my tongue to calm down. Like I couldn't sleep the other night because it was just throbbing. Nanette says, I have neuroma in my, I have neuroma in my feet. And hold on, I just pressed the button and I have neuroma in my feet and they want to take it out. It has become so painful. My hairdresser and I will have to be out for 2. I'm just trying to leave in God's hands. I think I just need to get out and get it out. Well, I guess you're right to be cautious. I've had steroid shots in my feet. Again, I also have a lot of foot issues from being an athlete, and I was an excessive stairmaster user, and I just loved running upstairs. I did 100 flights of stairs a day for 10 years, and not knowing I was blowing out my feet like mad. Nanette, I will tell you the shoes that I wear are Hoka's. And they have really thick padding right underneath the ball of my feet, and they're fantastic. So Hoka, HOKA 11 ONE, Hoka11.com. Check those out. I mean, my hairstyle, whenever I go get my hair cut, which is not often, which is you can tell since it's growing out a lot, um, all the girls are really, and the women, they're very, very stylish, and they often wear very, very high heels, and they're trying to present fashion forward. I just can't do that. There's no way with my feet. I have to wear tennis shoes. I just do. So also, the other thing I think that's worth throwing out is that as we get older, our ability to recover from trauma reduces. And so anytime you're facing major surgery, the sooner the better is kind of the approach, because your body is younger and more resilient. So the hard decision, you have to, yeah, it's a long recovery. Why don't you see if the doctor has any other patients who have had neuromas removed that you can talk to, so that you really have a glimpse of what to expect? That's not a bad idea. See if you can talk to somebody. Out for 2 months, yeah. On the other hand, look at it another way. Maybe it's going to be a really nice break for you to really calm and become calm and relaxed and focus on you for a change rather than other people. Christina says, in Canada, it's hydrodistensions, instills, or interstim as well as drugs. But after that, they've all told me they can't do anything for me. I've been at this for years, seen what I have been told by the best urologist. I've not been treated well by doctors at all here. IC is not a moneymaker here. So, Christina, you know, what the American Urology Association guidelines for IC say is if a patient is worsening over time, if a patient is not responding to treatment, if a patient it continues to have high levels of pain, it's very, very important to revisit the diagnosis. Let's make sure we know what we're treating here. Is there something that they could have missed? Could you have a fibroid tumor pushing on your bladder? Could you have endometriosis? Could you have, um, oh gosh, you know what? Like, man, I just built this whole new section of our website. You guys should come over and look at it. If you go to icnetwork.org, and then under the interstitial cystitis pull-out menu, go to diagnosis. And to the right, a link will pop up that says confusable conditions that can mimic IC. And so Christina, we want to make sure that you don't have radiation cystitis. If you've ever had radiation therapy for like cervical cancer, that could affect your bladder. Could you have chemocystitis? If you've ever gone through chemotherapy, that could explain your symptoms. Have you been exposed to ketamine? Do you have urinary retention? Do you have a neurogenic bladder? Do you have bladder stones? And in fact, hold on. So come on over to our website. Do you have estrogen atrophy? Do you have a prolapse, endometriosis, pelvic congestion syndrome? Pelvic congestion syndrome is interesting because it is basically varicose veins in your pelvic cavity, and those varicose veins can wrap around your bladder and cause all sorts of issues. And so, don't give up. It's time to start asking a lot more questions. Is there anything else that could be triggering my pain? Hold on a sec. I want to print something out. Hold on. Where is it? Screenshot.
All we're doing is showing everyone how
Uh-oh.
great we are at showing up.
Hold on. I don't know what
Lack
that
of
is.
empathy. That
Hold
hit
on.
me over the head.
What is that? Something's talking. Is it oh, you know what it is? That's Chelsea Handler. That's a podcast that I accidentally started. That's hysterical. Okay, so hold on a sec. Let me see if I can print this out. I want you to see this picture. Yeah, awesome. Okay, good. It's going to print out well. Here, hold on a sec. Let me print this out. Okay. It'll be a minute. You watch. Something's going to fall down when it comes out, I think. No, it would help if my printer was on. All right. Alan says balance makes free and clear, gentle of dyes and perfumes. I still wouldn't use it, Alan. I still wouldn't use it. It's still going to add chemicals to your clothing. I don't trust them. I just don't trust them at all. Jenna says, who would you recommend in New England? My urologist who diagnosed me years ago has kind of dropped the ball at this point. I'm in a lot of pain now and need to find out what is going on. I think I would head down to Long Island, Jenna, and go see Robert Moldwin. Like mold on bread and then win a race. Robert Moldwin. He's out on Long Island. You know, Alan, I just don't trust the chemical industry that much. Take it from somebody who's trained as a chemist. I think they're getting away with murder, putting stuff in. Okay, hold on a sec. What did I do? Facebook? I just did something weird. Okay. Oh, I accidentally pinned a comment. Okay. Okay, did it print out? Oh, it did. Okay. So if you follow me on Twitter and on Facebook, I put up this picture. Okay. What do you think it is? So this picture was taken through a cystoscope in the bladder in an IC patient. What do you think that is? Any guesses? It's large. It looks like a piece of rock candy. And there's a lot of them. There's this one here, there's one here, this couple down here. Anybody know what that is? Yeah, that's what it is. This is a bladder stone. Now, what makes this so interesting, so this patient is a very, very good friend of mine. And he started passing, his case is very, very complex, not a typical IC patient. He's he was injured in a procedure. He had a doctor do surgery that was absolutely unnecessary that damaged him badly. That doctor is now in jail. It turned out he did it to a bunch of people. And anyway, this particular patient has now had 12 to 13 to 14 surgeries in the last 2 to 3 years to try to repair the damage done by this first doctor. What happened is this is a perfect example of a patient who stayed local and completely exceeded the skill set of his local doctors. He should have been national very, very early, but he kept saying, I like my guy. I like my guy. I think he can do it. I think he can do it. And so his local urologist had been trying to fix the damage done by the surgeon who's now in jail. And just trying to understand it. And it turned and it wasn't IC at all, but they ended up blocking a duct and things became gangrenous. It was just a nightmare, right? So anyway, before his second to last surgery to fix this surgical error, they had to remove most of his prostate, and he had a bleeder that they missed. And what happened is his bladder filled up with blood clots, just blood clots. Couldn't pee, it was just blood, thick, gooey blood. And so it's an emergency situation. They had to open him up through the belly, emergency surgery. And literally, as they get to the bladder split in two, and all this blood came out, just massively overstressed. Again, he was hemorrhaging. Again, not IC. This was a medical malpractice surgical repair situation. Anyway, so they had to restitch his bladder up, right? I mean, it just split in half, restitch his bladder up. So after that surgery, he started passing what he thought were kidney stones, big mofos, big kidney stones that were getting stuck in his penis, and he'd have to try to get them out of his penis. The suffering, terrible, terrible suffering, over and over and over, stone after stone after stone. And his local doctor was like, didn't quite get it. They didn't understand it. So we get him to a national doctor. If you're over on Twitter, that national doctor actually responded to the picture he took, Dr. Ken Peters. And it was Dr. Ken Peters who found this giant, giant, giant groupings of calcium stones coming out of his bladder wall. They were not kidney stones at all. They were emerging from his bladder itself. And it turns out that he had suffered such a catastrophic injury when they stitched his bladder together that it had disrupted a calcium mechanism, some sort of calcium processing mechanism. And this is what happened. All along the surgical spot, kidney stones emerged. And it could also happen if there were a stitch. If there was a stitch there or a foreign body there, the calcium oxalate in your urine would slowly uh, would slowly crystallize and become bigger and bigger and bigger. That wasn't the case in this situation. It was all, you can kind of see the line, all along the surgery lines, and the area that was repaired, stones started to emerge just because of the catastrophic damage that was done to that tissue. He's fine now. This patient is fine now, but they had to go in a couple of times and just take all these stones out. So this guy, diagnosed with IC, was not an IC patient at all. He was a surgical error patient. So again, you want to revisit the diagnosis. No bladder treatment would have fixed this. Elmeron would have done nothing for this. This was a very specific biological response to trauma, and they had to do something different. So again, every patient is an anatomical mystery to be solved. Isn't it? I mean, he like texted me that day these pictures of what they found in his bladder, and my jaw dropped. It's like, oh my God, these were like monsters. And it's very, very rare. In 25 years, I've only worked with 2 patients that this has happened to. You shouldn't assume this is not connected to IC in any way. But it just shows that you've got to step back, reconsider the the position, and ask yourself, could they have missed anything? Holly says, I've been to 3 physical therapists and none have helped. So Holly, the most important part of physical therapy is not your appointment with the physical therapist, it's what you do at home when you leave the physical therapist. So the question number 1 I would want to know is, number 1, did they all diagnose the same thing? Did they all make the same finding in your pelvic floor? Was it your levator on your left side, or was it your, whatever muscle group? Did they all identify the same muscle group? Number 2, did it change over time? If the first one couldn't get to it, did the second one, when the second one went in and did your pelvic floor assessment, had anything changed? Et cetera, et cetera. And ultimately, in the end, remember, anytime we see persistent pelvic floor tension that's not responding to therapy, we always want to look at bony structures. Do you have scoliosis? Do you have one leg longer than the other? Do you have a hip that's displaced? Do you have an SI joint? Pelvic floor physical therapy is going to only be temporary until that anatomical abnormality, that bony structure dysfunction, is addressed in some way. Oh, Nanette, where's the Hokas? Awesome. Listen, girl, if you're already wearing the Hokas and you're still having pain, then your neuroma must be pretty intense. So thinking about that surgery, I think that's reasonable to try to get you pain free. But you got to look at the pros and cons. Bring any concerns you have to your doctor. You know, the other thing about this picture that's so interesting, guys, so you got to remember your urine is filled with minerals. Calcium, oxalate, sodium, all sorts of minerals. And anybody who's ever had an indwelling catheter, like a Foley catheter, you know that putting the catheter in is a breeze. Taking it out 2 or 3 days later is rough. Why? Because literally the catheter has become rough. That the minerals in your urine are now attaching to the catheter. And so what happens is the smooth surface becomes bumpy with sharp edges. And you can really see that this is crystalline. I mean, it looks like a school science project. You can see the crystal edges. It's crystals. And this is just crystals coming out, you know, that have formed from calcium. That's why one of the biggest risks of bladder stones is becoming dehydrated. If you're dehydrated, your urine gets concentrated and concentrated and concentrated, and and there's something called a saturation point or a supersaturation point. I forget which one it is, where the crystals hit a certain saturation level in the fluid before they start to crystallize and create flakes and start building things. So drinking lots of water is important. You got to keep your urine dilute. I mean, when I say lots of water, your normal 6 to 8 glasses of water a day. If your urine is dark yellow or brown, you're dehydrated and you're running the risk of crystals forming. If your urine is clear with no coloring at all, you're drinking way too much water and you're going to mess with your sodium levels and your electrolytes. Your urine should be a pale, clear yellow, 6 to 8 glasses a day. Everybody's slightly different. Holly says, I do have a curved spine, one leg longer than the other, and tailbone that twist. Girl! Okay. Holly, seriously. Okay. You're just like me. So of course, pelvic floor physical therapy is not going to have a long-term success for you until your bony structures are addressed. So you have a curved spine. I have a curved spine. I've got an S curve on my back. I'm supposed to be an inch taller. I mean, if I stand, you can't see. Well, you can see that I have a curve because look, this waist is about an inch lower than this one, or a half an inch lower, right? So my hips are definitely slightly off from that scoliosis, which has definitely contributed to my SI issue. One leg longer, so you've got one hip that's higher, right? And so when you walk, they're not working together. And so hopefully they're talking about that. They would normally give you a lift or something, you know, it depends on how many millimeters off it is that you can put in your food. And then, of course, you've got a tailbone that twists. And the question is why? And you're going to chiropractor every couple of weeks, and the adjustments never hold. And the adjustments aren't going to hold until they really understand the root cause of why your bones are doing what they're doing. I don't know why your tailbone is twisting. And your leg longer than the other, that is potentially addressable with a lift inside one shoe that would at least get your hips level. But of course, now your body's so used to being off that your muscles have adapted, and it's going to be a journey. But until you're able to stabilize those bony structures, your muscles are going to be, you know, they're not going to fix the problem. They can't, they're going to be a part of the solution, but right now they're compensating for dysfunction. You got massive dysfunction going on. And so I think it'd be really interesting to go back to a physical medicine specialist and say, listen, I have got chronic long-term pelvic pain, pelvic floor dysfunction for my muscles. Clearly, this has something to do with my bones and my leg and my tailbone. Can we please revisit those and see if there's anything we can do to fix any of that? It's doable. It's doable. I'm doing it. You know, my muscle pain over a period of 10 years was just getting worse and worse and worse and worse. And finally, last year, I was just like, I'm so over this. I can barely sit here and work because my left piriformis muscle was screaming at me all the time. And I realized I had outpaced the Kaiser Permanente and my local doctors. And I just went, okay, I'm paying out of pocket. I'm going to go see a professional trainer. And I did. And the professional trainer nailed it in 5 minutes. He goes, I know exactly what's wrong. It's your SI joint. He had me walk down the hallway and he goes, do you know that when you walk, you don't walk straight? You walk like this. You walk like in curves, right? Whenever you walk, you curve to one side. I'm like, no, I do. He goes, yeah, you do. He goes, do it again. So you're doing it. I'm like, I don't know. I'm doing that. I had no clue I was doing that. He goes, that's your SI. That's your SI. And then he even went even further and he was looking at how my muscles were turning on and off. And what he found was that my left side was so weak that my right side was doing all the work, which is why I was going to the right. And so and then he said, "Well, what have you been doing for this?" And I went, "Well, Kaiser's had me stretching. So for 10 years I've been stretching, like yoga stretching. I can touch my nose to the ground when I stretch. I am really flexible." And I demonstrated it for him and he looked he like I just showed him one of my stretches and he went, "Oh my God, stop." Like, why? Because you're weakening it. You're making it so much worse because but you've overstretched it so much on your left side that it has no strength anymore. He said, you may not stretch for a year, a year. And he's the one who's finally figured it out for me. And now I'm doing this slow program to rehabilitate everything. And it's getting better. Like now, I couldn't do this before. I could not do this before, right? If I did this, my legs would tremble. And now I can do that. And I thought it was all, just ex-athlete getting older. It's like, no, it's your SI joint. And you've made it that much worse. So, Holly, I think you need to do kind of the same thing. I think that you need to go back to a physical medicine specialist and have them try to understand why your pelvis is doing what it's doing, because it's not normal. Let's see here. So I need an opinion from you guys, okay? So for 2020, for this year, we're gonna be doing a lot of videos. Like literally every page of our website is gonna have a new video on it. I'm just upping the game and improving everything and updating everything dramatically. I just want to make it better and better and better. But here's my problem. My problem is that I have so many phone calls now from doing these streams that um, I'm on the phone all day. I'm absolutely on the phone all day. Like me write an article on IC right now, it's very hard. And ultimately, in the end, that's the funnest part for me is doing videos, doing streams, writing content. And I love working with everybody. Believe me, you make my days wonderful. But I only have a certain number of hours in the day. And so I want to ask your opinion on something, okay? I was thinking that I would instead do office hours online. So rather than now I just want your opinion because I'm just trying to figure it out. So I'm thinking if I did office hours online in a stream like this, probably on Twitch, for 2 to 3 hours, where somebody calls me, and normally they would be able to call, and we would answer the phone. It would say, if you've got a basic question on IC, please come to our office hours on Monday, Wednesday, Friday at this time, where they can answer the question, they can ask the question online. And then what I would say is, if you want to spend more time than this, well, you could sign up for coaching, right? But I know a lot of people don't have access to the internet, and I understand that too. Um, but what would you think about office hours? 2 hours, 2 hours, a couple of times a week, where you could just come in and ask questions. Kelly says that sounds great, having office hours online. Nanette says, what kind of doctor do you see for your scoliosis? An orthopedic surgeon at first when I was younger, but a physical medicine specialist. That's what they're called now, a physical medicine specialist. Any comments on office hours? If you've got questions on IC, you could just drop in online and ask a question. Would you find that helpful at all? I'm curious. I'm curious. I might do that as an experiment. Kay says that sounds good. Heidi says that sounds good. I gotta write. I gotta produce more. Sharon says, I think that's a great idea because I feel guilty taking your time. No, you don't need to feel guilty. This is the best part of my job. Are you kidding? I enjoy every minute of it. It's just that it's a Sunday. I don't mind Sundays though. But I take a little bit of time on Monday, so I get a little bit of time off. But I mean, I definitely got burned out last year working 6 days a week, sometimes 7 days a week. So you guys like that idea of office hours? Interesting. All righty then. I like that. Hello, Beth. Welcome. Chris Curran says, I heard one of the people today found out they had a lot of scar tissue that caused them pelvic pain after an MRI with an MRI after years of misdiagnosis. I was told by urogyno that they can't see if scar tissue from 2 toddler age bladder surgeries, and if my bladder is adhered to another organ and can't empty, what type of doctor can do MRIs? Well, a radiologist. A radiologist would be the one who would probably be the ultimate master at the anatomy, but it would be a radiologist either working with a urologist for you, Chris. But again, I mean, with that level of intricate injury at such a young age and understanding the long-term ramifications of that, you're going to outclass very quickly a local specialist. You really do need to up your game and go see somebody who has a lot more experience, either a regional doctor at a local university or a national doctor. Where do you live, Chris? What state? I'm drinking my pumpkin spice rooibos tea, which I have to order more of. Wisconsin. So I would head to Detroit to Ken Peters, to be quite honest. I wouldn't go to Mayo Clinic. While a lot of people think that Mayo Clinic is really the best when it comes to cancer, and they absolutely are one of the best when it comes to prostate cancer and stuff. But when it kind of comes to IC and chronic issues, they fall far, far short. And if there's I mean, it would be maybe an hour plane flight for you from Wisconsin to Detroit. And it's a 20-30 minute car ride, or maybe 40-minute car ride from the airport. I think I would head to see Ken Peters and see what has to say. You can reach out to their clinic, and in many cases, the doctors will talk to you ahead of time They'll either talk to you by email or they will give you a phone call. Okay, we sell coffees and teas over on our website. This tea right now, we're out of stock in pumpkin spice herbal tea, and I'm hoping that we're going to get it back in a loose leaf formula. This specific tea is by Harney and Sons, Harney, Harney and Sons. Yeah, Sherry, it would just be like a stream, just like this. It would just be office hours. I would just classify it as office hours. So Harney and Sons is known for these little silken tea bags, these clear silk tea bags. And it turns out we had research that was released this fall that showed that these little fabric tea bags are actually release thousands of nanoparticles of plastic into every cup of tea. So the company, nobody knew this. Nanoparticles, the study of nanoscience is very new. So as soon as that research study came out, I sent them all back. And I saved some for me, and I use this, and I just open up the tea bag and I dump it into this. Cost me like $3 at a kitchen store. And so I've gotten rid of the plastic. So I don't have the loose leaf to sell. I'm going to try to get it. It was out of stock when we tried, but I'm not going to sell any herbal teas that come in these silken bags because nanoplastics. I'm appalled. And that's the challenge with going to Starbucks and places like that is a lot of them use these nano tea bags and they kind of scare me now. I don't want to be drinking microplastics because where do they go? They're going to accumulate somewhere in your body if you can't pee them out. I mean, will the plastic get into the bloodstream and will it go to the kidneys? I don't know. All I know is plastic is evil in the human body. So Chris, it's Beaumont Health, and it's not in Detroit. It's outside of Detroit in Royal Oak, Michigan. Just Google Ken Peters, urologist. He's the chairman of the urology department at Beaumont. And he's a master diagnostician. Like literally of anyone in the country, I think his level of finesse is outstanding. So between he and Dr. Robert Evans, Rob Moldwin, I think that they're the ones who would be able to tell you how those surgeries would be influencing you today. And, at some point in time, to answer your question, it might be reasonable to ask for a laparotomy, a mini exploratory. A laparotomy involves him. I mean, I've had 2 laparoscopic surgeries. They basically do an incision, like 3 little 1-inch incisions, and they insert scopes in, and they take a look around in your pelvis that way. And that would help them see if anything is adhered to your bladder, et cetera, et cetera. And that's really not a bad idea given your situation, given the fact that, you had major trauma. And if you suspect that, that might be the best way for them to see it. The advantage of a laparotomy is they generally do it with, it's a very short procedure. You're talking 30 minutes, unless they find anything weird that they have to repair. It's a lower scale anesthesia. I had propofol, which is fantastic. Propofol, which is what Michael Jackson died of because it was misused in that situation, is a very shallow anesthesia, and it doesn't numb the nerves in your pelvis so that you can pee right away. The problem with a major, like when I had my hysterectomy, they had to use much stronger pelvic anesthesia. And even then, I could still pee within an hour. Whereas 20 years ago, when I had a laparotomy, I couldn't pee for 4 or 5 hours until the anesthesia wore off. With the propofol, the anesthesia wears off in minutes. And it's easy on, it's easy off. So, I mean, have that discussion, at least the pros and cons and your suspicions, and you never know. Kind of like the doctor. I've told the story of I was an internal medicine doctor that I met last year, who was a runner, and all of a sudden running started hurting, and then she started having bladder symptoms, and then the doctors didn't believe her, and they did the testing, nothing happened, and then one day she passed um, in her urine a knot of stitches, like blue polypropylene stitches popped out of her urine into the toilet. She's like looking down going, what the hell, what, those are stitches. And she felt better, and then it got worse again, and then it got worse and worse and worse and worse until she could barely walk. They opened her up, through a laparotomy, and what did they find? Her belly was filled with blue polypropylene stitches floating through her body. And this is the same stuff that mesh is made of. So it literally migrates through tissue. So the polypropylene stitches were some of them had attached to her bladder wall and worked their way through her bladder and into her urine. They were on her back, they were everywhere. And it turned out that 20 years earlier, she had had a tummy tuck for pregnancy after she delivered a baby. And she let an intern do it who clearly used the wrong stitches. He used the stitches meant to close a wound, not the stitches meant to be used in the belly that never dissolve. And so, she needed if they hadn't done the laparotomy, they never would have found that. It's fascinating. Any national doctor near Miami? There is a new, Louisa, there is a brand new South Miami IC support group you have got to connect yourself with. I put them over on our website. They called me like last November, and I put them up, and I haven't had a chance to promote them. Resources in the Miami area have been slim to none, and you now have a fabulous, I think it's a nurse, who's running this new IC support group in South Miami, and she would be able to connect you to anybody. So over on our website, icnetwork.org, go to our support group listings, look at Florida, look for South Miami, and they will help you, okay? Chris says, I used to live near Royal Oak. My understanding is at that time frame, they actually moved my bladder when they fixed the valves to my ureters. Weird. Okay. I'm not a surgeon, so I don't necessarily understand the ramifications of that. But that they would move Ken Peters. I think given your situation and your previous surgery, you need to see a master surgeon, and that's going to be Ken Peters, Robert Evans, Robert Muldoon. Are they going to be the top 3? If you're on the West Coast, Chris Payne. 52 years ago. Amazing. Yeah, but remember, a lot has progressed in 52 years. We know how to do things better now. That was the dark ages. 52 years ago is when they were doing urethral dilations. And so it would be very interesting to have an opportunity to look at those tissues and see what's up, if anything. Bye, Jana. Peters, Ken Peters, Peters. All right, guys. Well, we've been going for 2.5 hours. I'm not ready to stop. If you got questions, I'm happy to take them. I've answered all of your questions that I can see so far. I do have another story that I can talk to you about, but give me some questions. Anybody got anything else? What's going on for the new year? Anybody got any procedures planned? Doing anything different? Anything? I am working right now on an article for our website. Uh-oh, look at that. I just started the... That's hysterical. All right, hold on. I'm trying to close iTunes. Okay. Closed. Good, 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 good. Okay, where is it? Is that it? Yeah, here it is. All right. Give me your questions. Challenge me. Nothing is off the table. So I'm working on an article right now on the things we loved and hated about 2019. And so I thought I would go through those. So while you're okay, Heidi says, I have lidocaine gel and estradiol. How do I take them at the same time? Is it an estradiol cream and a lidocaine cream and a lidocaine gel? You could just, I mean, mine are mixed together in a gel. It's compounded. Works like a charm. I love it. Gabby says, please talk about vulvodynia. I'm suffering from this. Okay, so vulvodynia means, dynia means pain, and vulvo means vulva. So somebody would be prescribed. I mean, somebody would be diagnosed with vulvodynia if they have pain of the vulva, especially if they don't know why and what and where. Um, um, so the first thing you've got to remember about all of your skin down there is that they're mucous membrane covered organs. So, and that this is kind of the mystery and the amazing part of the bladder. Think about the bladder for a moment. The bladder is the only organ in the human body designed to hold toxic waste, right? Because urine is body waste. Urine contains ammonia and urea and all sorts of irritating things. So, how can the bladder hold ammonia for hours at a time and not get damaged? And the answer is that your bladder is like your mouth. It is a hollow organ covered with a thick coating of mucus. And this nice thick mucus acts to protect the skin from whatever's floating in your urine. So it's a mucous membrane covered organ. And that mucus production is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus and your bladder is able to defend itself well. When you're older, you have much less estrogen, therefore much less mucus. So your bladder and your urethra's ability to defend itself is much less. And your urethra is kind of like the canary in the coal mine. Your urethra is often one of the first areas to start screaming when your estrogen levels drop to a certain point that you don't have adequate mucus. The vulva is the same way. One of the first signs of, of estrogen atrophy is vulvodynia when you're peeing. If your urine feels very hot as you're peeing and it's burning as it's crossing your vulva, it's not that your urine is unusually hot. It's that your vulva cannot defend itself as well because it does not have a good coating of mucus. So when we think about vulvodynia, we're really thinking about the quality and health of your skin down there. Is it moist? Moisture is essential. If it's not moist and it's dry, then chafing is going to hurt. Wearing pants is going to hurt. It's dry. It's supposed to be slippery. And women, older women, you know what I mean. You know that when you get really dry down there and you're walking, you feel it. And you have to go get your KY and rub it on your vulva so things are slippery so that you can move nicely and you don't feel it. So the first thing we look at with vulvodynia is estrogen levels. We want to look at the quality and health of your skin. Is it healthy? Is it moist? Can it defend itself? The second thing we want to look at is chemical irritation. Is your vulva being irritated by any sort of chemicals? I had vulvodynia in my 20s, in my 20s, and it was bad vulvodynia. I couldn't wear jeans for a couple of years. It felt like somebody had rubbed the skin of my vulva off with sandpaper. And gosh, when I think back to that time, I mean, obviously, I don't it resolved. I went to vulvodynia support groups and I learned about stuff. Um, One of the most important things I learned is how important it is to change your diet, how important it is to check for yeast. I had a drug resistant Candida glabrata infection on my vulva for 3 years. That was very, very hard to diagnose, hard to treat. Using a perineal wash bottle, that's probably the most important piece of advice I can give you. Let me go get a sample. Let's see, do I have it in here? So all the people who join the IC network as members get a Perry bottle as a sample from me, and I mean as a gift from me. And I know that that's weird, but it's just a bottle with a squeeze top. You fill it up with water, you leave it next to your toilet. Every single time you use the restroom, before you use toilet paper, you want to rinse yourself off with water first, because toilet paper is not going to get bacteria off of your skin. Toilet paper is not going to get contaminants off of your skin. Water will. And if you care about the environment, what you could do is for urination, rinse yourself off with water and then pat dry with a hand towel. You don't even have to use toilet paper. It's the chafing of the toilet paper, the dryness of the toilet paper that has the potential of really, really irritating the vulva. Okay. And some toilet papers are better than others. Some toilet papers leave a lot of fragments that kind of accumulate on that skin down there and can be irritating. I'm now using a bamboo toilet paper and it's much, much better. I could have stock in Costco toilet paper. I used to buy three big things every time I visited. I don't do that anymore. I now use bamboo toilet paper and my Perry bottle, using a lot less, and I feel a hell of a lot better. Sometimes patients can have infections in glands. And so they would use a Q-tip and they would touch glands to see if you got vestibulitis, vulvar vestibulitis. And in many cases, vulvodynia is really directly connected to tight pelvic floor muscles. So if you're not menopausal, if your hormones are normal, um, we want to look at the pelvic floor, because if your pelvic floor muscles are super tight, they're restricting blood flow to the vulva, just like they would be restricting blood flow to the bladder. And what we have found in multiple research studies is pelvic floor physical therapy is remarkably helpful at reducing symptoms of vulvodynia for patients with tight muscles. Don't underestimate as well the challenge of soaps. You got to be really careful of the soaps that you're using. You shouldn't be taking bubble baths. You should only be using free and clear products. No fabric softener, no dryer sheets of any type, even if they're free and clear. Always rinse twice. Get all the chemical residue off of your underwear. White cotton underwear rather than blue. Blue dyes have been known to be more irritating to some people. Be very careful with mini pads, because mini pads, aside from the chemicals that they release when they get wet that can irritate and burn you down there, mini pads also suck the moisture out of your skin, and you need that moisture. You also might find it very, very helpful if you have vulvodynia to use a vino. Here, let me get it. Hold on. Okay, so Aveeno soothing bath treatment. This is the bomb for some people who've got vulvodynia. Getting in and soaking in warm water with Aveeno can really calm and soothe it. Andrea, you didn't get your Perry bottle? Girl, send me an email and I'll send you a Perry bottle, okay? I'll make sure it happens. So Aveeno can be very calming and soothing. Coconut oil. If you feel dry down there, using some extra virgin organic coconut oil would be very, very helpful. And then there are also two vulvodynia nonprofit organizations. There's the Vulvar Pain Foundation, which I think is excellent, and also the Vulvodynia Foundation, which is excellent. So you should go over to their websites and read what they have about it. I think in the end, when I think about my personal history with vulvodynia, I think a lot of it was chemical irritation that just got worse and worse and worse over time, and um, now that I've taken almost all the chemicals out of my daily life that would touch my skin, especially anything down there, I'm so much better. And I haven't had a major vulvodynia outbreak in 30 years, except for last year, I had a weird prickling sensation that it turned out was pudendal neuralgia that we have now fixed. So that's a whole nother story. Hope that helped, Gabby. Deb said, Deb from Canada, what do you think of naproxen for pain relief? I think if it helps, go for it. I've never used it myself, so I don't really have anything to say about it. Heidi says, I have two different tubes. Can I mix them together? Yeah, usually they're quite mixable together. Any doubt, ask your pharmacist. Mine are compounded together in a gel format. So I've got estrogen lidocaine that actually we started using to calm the nerves down on my vulva because of this pudendal neuralgia that I had. And ultimately, it was physical therapy to deal with this tight, this tight left piriformis that was triggering all of these symptoms for me. But we also still had to calm the nerves down, and using the estrogen lidocaine was really helpful for me personally. It's like in a Vaseline mixture, but it's fine. It's wonderful. I don't use it very much anymore because I haven't had it. I might get a little tiny prickling sensation every now and then, but now I know I need to go into the living room and go get my yoga mat out and do what I need to do to get things to calm down. And of course, do internal pelvic floor massage with my wand. That's the most important thing. Sherry says, buprenorphine is starting to work for you. Pain is less often, but still gets to a 9. The Norco is being cut back while increasing the norphine at the same time. Sherry, are you doing the Peora too? I mean, it'd be really interesting to see if the Peora helped. Heidi says, so don't use dryer sheets at all, including, no, hun, I wouldn't touch any of those with a 10-foot pole. No, 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 because they're all leaving chemicals. They're all leaving a chemical coating in your fabric, whether it's your underwear or the towels that you're using, this leaving a chemical coating. And the consequence of that your repeated chemical irritation on your vulva can take a toll over time, especially as you get older. Okay, somebody asked about prolapses. Sharon says, bladder prolapse. I'm IC subtype 2 and 3 under control. How much ache and pain would a rectocele and a cystocele cause? Not IC pain, but an ache down low in the abdomen. Would surgery help? Sharon, I don't really know how to differentiate between a rectocele and a cystocele. I mean, with a rectocele, you've got feces potentially accumulating in a pocket that's pushing into your vagina. With a cystocele, you've got urine accumulating in a pocket pushing into your vagina. It depends upon the degree of the prolapse. I mean, if you're at the point where literally your bladder or something is falling through your vagina and outside of your body, you are absolutely at the surgery point. We want to catch it. You want to catch it, any prolapse, when it's very, very small, so that the muscles are not so massively damaged that physical therapy could help. But if you get to the point where you allowed the muscle weakness to worsen and worsen and worsen, you might get to the point where surgery is your only result, your only course of action. Here, one sec. All right. Oh, that's so funny. That was my 97-year-old dad who decided to start playing the piano. When I asked him to stop, he started singing opera. He's adorable, but he's making me work my butt off, let me tell you. So anyway, Sharon, I want to tell you the story very briefly of a prolapse patient that I work with. And in fact, I just had a call with like right before Christmas. They discovered her prolapse in her 70s, and she had a bladder prolapse, and it was affecting her bladder. It was affecting her symptoms. She was having a lot of pain and discomfort from it. Um, they offered her surgery, and she said no. She didn't want to do the surgery. Well, the prolapse worsened and worsened and worsened until finally, in her late 80s, her bladder was literally almost hanging out of her vagina. She couldn't walk at all. There was a hard, round knob sticking out of her vaginal cavity. And what they had to do is give her a pessary. And she's now in her 90s and is using this pessary that is uncomfortable, but at least is keeping her organs in place. But she massively regrets not having the surgery when she was younger. She feels that if she had acted early and promptly to address her muscle health, she would not have, she would not be in the severe distress she is now. And so you got to remember that you have to ask your doctor about severity and could this get better? Could this get worse? Your muscles have a fine point where, up to a certain point, physical therapy will work. Kegel exercises have the potential of tightening weak muscles. But once you get past that mysterious line, you're at the point where physical therapy cannot work and surgery might be required. So you got to have some good discussions with your doc about where you are right now. Kay says, do I know anything about the medication Urabel? My Urogyne gave me some samples to try, but I haven't taken them yet. Urabel is not a treatment for IC. It's not mentioned in the IC guidelines. But it has been commonly used for symptom management, but I thought it was discontinued. Wasn't it discontinued last year? Either there was some sort of drug shortage or something like that associated with it. It's really just kind of one of those general medications where it's like Euroblue, like whichever was the one somebody asked about earlier. They're all in the same class of meds, where there's a little bit of methylene blue in it or methenamine to kill bacteria. There's a little bit of this, a little bit of that, a little bit of salicylate for pain, but it's not really a therapy for IC. Jacqueline said, I'm dealing with gas, bloating, stomach aches every morning that wakes me up with an icy flare. Could these symptoms be related to a digestive issue? Yeah, definitely. IC does not cause gas, bloating, and constipation. Okay, you absolutely have a GI thing going on with that. And so the question is, what could be happening? Um, uh, are you on a medication that is triggering constipation? Or are you eating foods that are gas producing? I was working, I had a lady call me with your exact thing. She was having your symptoms exactly every morning, waking up with stomach aches, constipation, cramping, bladder symptoms, et cetera, et cetera, et cetera, and with massive gas. And so we were talking, trying to figure it out. And I go, well, are you avoiding the gas producing foods? And she goes, what are gas producing foods? And I'm like, you don't know this? I thought everybody knew that some foods cause terrible gas. Cauliflower, Brussels. You couldn't pay me to eat a Brussels sprout right now. I get the worst gas from Brussels sprouts. And she's like, what? And I'm like, Google it. Gas producing foods. There are a lot of foods absolutely well known for triggering high levels of gas. And I said, do you eat any of these? She goes, yeah, I eat Brussels sprouts every day. It's my snack. I'm like, oh my God. She cooks them and then she puts them in the fridge and it's her daily snack all day. She just eats handfuls of Brussels sprouts. And I told her, I said, oh my God, if that were me, I would be in the hospital. I am so sensitive to Brussels sprouts. They give me the worst pain and the worst gas. And she was like, but I don't want to give up my Brussels sprouts. And I'm like, honey, you're having terrible gas, cause and effect. You're eating Brussels sprouts, you're getting gas. End of story. Google it. And she called me up like 6 weeks later and it was worse, right? And I said to her, I said, did you stop the Brussels sprouts? And she went, no. And I'm like, oh my God. Did you Google gas producing foods? No. Oh my God. you know so she finally stopped the Brussels sprouts, and guess what, all of her symptoms went away. So Jacqueline, not to make light of your situation at all, number one, we want to look at, let's make sure you're avoiding the foods that we know trigger a lot of gas. Number two, we also want to look at um, uh, a variety of stomach disorders that we know are somewhat common in the IC patient community. IC patients, myself included, tend to have irritable bowel. We have a sensitive stomach, irritable bladder, and we tend to have a sensitive bowel, irritable bowel. The connection is somewhat of a mystery. For some people, it's all about the biome. For other people, it's all about the muscles. And for some people, it's about genetics. And for many people, in all honesty, the IC diet, if you're being really extreme with the IC diet, you're probably not even coming close to eating enough fiber. You should be eating 20 to 25 grams of fiber a day as a woman to have a normal bowel movement. And for a man, you got to add 5 grams of fiber on top of that, 25 to 30 grams of fiber to be normal. And so many IC patients, number one, what do? They stop drinking water. When you stop drinking water, guess what? Your bowel movements become very hard. They're like hard rocks. Your body needs that water not only to dilute your urine, but to soften your stool. The second thing, of course, is fiber. We've got to make sure you've got a good source of soluble rather than insoluble, soluble fiber, so that your bowel has what it needs to be function normal, and of course to feed the good the good beneficial bacteria in your bladder. And so count up your fiber, especially if you're having hard, painful stools. And let's try to get your fiber intake up a bit. As an example, I eat 2 pieces of Ezekiel bread. That's 6 grams of fiber. I eat an apple a day. That's another 4 grams of fiber. I love green peas. So you're going to see me eating green peas or baked beans almost every day of the week. And things are so much better now that I'm doing that. Now, the third thing that we want to look at too is something called gastroparesis. Gastroparesis When we surveyed IC patients a couple years ago to ask about stomach issues, 95% of the patients who participated in our study reported stomach issues. And some of them had IBS, some of them had just a variety of stomach issues. But the one that resonated the most with me is something called gastroparesis. Gastroparesis stands for delayed stomach emptying. And so what it means is that food sits in your stomach longer. And as it sits in your stomach, what does it do? It starts to ferment. And as it ferments, what does it do? It produces gas. And so if you've ever made yeast bread, and you've got to prep the yeast first, what do? You pour dried yeast into warm water with sugar. And what does it do? It starts to foam and bubble and produce gas. That same exact thing happens in the stomach with gastroparesis. The food will sit in your stomach for a longer period of time, and it will just basically start to ferment in your stomach and produce gas. So if you're belching, that means you've got gas in your stomach, which we would attribute to really more to something like gastroparesis. If you're farting, then we're really going to look at foods that, as they get metabolized, produce a lot of gas. So you definitely need to talk to your doctor about your gut issues, and see if they can help you try to figure out what that could be. But the whole delayed stomach emptying is something that happens to me. I don't eat because I've been diagnosed with gastroparesis, and it hit about 10 years ago. For about 6 months, I was having a lot of trouble eating. I was belching all the time. My stomach was so bloated with gas. And it turned out that I had this delayed stomach emptying. And so I switched my foods. Instead of eating 2 or 3 really big meals, I ate a lot of little tiny meals. And then I also removed the foods that triggered gas for me, which was ironically lettuce and spinach. I don't eat leafy green vegetables, and I'm so much better. I eat tons of salad. I just don't put lettuce in it. I do carrot salad and beet salad and pea salad and cucumber salad. I do lots of salads. I just don't do lettuce. Those leafy greens, for me personally, produce a lot of stomach gas. So search for gastroparesis, G-A-S-T-R-O, paresis, P-A-R-E-S-I-S, and read about it. You might have some of that going on. Sharon says, I have tentatively scheduled surgery next month, and I'm so afraid that it will flare my IC. But like you, I need help. Yeah, especially if you're going to have foot surgery. I mean, you're going to be hobbling. You're going to have your leg in a cast, and you're going to have your little scooter probably. And you're going to have your leg up on a scooter, and yeah, you're going to be down for the count for a while. So make sure you get the help that you need. Don't be afraid, hun. Don't be afraid. I am strong. I am intelligent. I am educated. Use your I am statements. Kristen says, I've had a rectocele repair and pelvic organ prolapse repair. I still have pain and pelvic distension. Well, and so the question is what structure is that pain coming from, Kristen? Is it coming from muscles or is it coming from an organ? Deb says, I have slight bladder prolapse and now use pessary. Hallelujah. My urologist did not want to do surgery due to the condition of the bladder. If the pessary is the right size, there should be no pain. Absolutely, Deb. Absolutely. Congratulations. I'm glad that's working for you. Kristen, do you know why you still have pain? Is it your muscles or is it an organ? Your bladder, your uterus, anything? Do we know? Sherry, I'm doing bladder builder, but not Peora. I cannot believe that the government, because of the new law, Norco is being phased out in chronic pain patients, but the buprenorphine is slowly helping. Yeah, it's very sad. Kristen says hydroxyzine is awesome, and when I'm dealing with flaring, gabapentin helps a lot. Medical marijuana also helps. Cool. Jacqueline, currently taking Miralax. Well, okay, so Jacqueline, that's good because that's giving you fiber, but what are you doing to nourish the your biome? Are you taking probiotics, prebiotics, acidophilus, anything at all like that? You got to also, I mean, clearly something is wrong. You're producing gas. And we got to figure out why. And it's either a byproduct of the food or it may be that your biome is disrupted and you don't have the right balance of beneficial bacteria in your gut. If especially if this happened after you were taking a lot of antibiotics, that's a possibility too. Kristen says vaginal Valium suppositories help. Okay, so if the vaginal Valium suppository is helping that pain, then that means you're having pain from muscle tension. So the question really is why? Why? You know, is there did they get too tight? Do you have a new muscle issue? Do you have an SI joint dysfunction, hip dysfunction? Is there something else that's triggering your pelvic floor? Rhonda says, "Hi Jill, I have gastroparesis. I get Botox shots in my sphincter muscle. Extremely painful. I've been on a very strict diet for years. It took 4 hours to diagnose. Same here. Spinach does the same." Yeah, isn't it weird, Rhonda? I mean, like I thought it was eating a spinach leaf, but when I eat ground up spinach, like a cream of spinach soup, same exact thing happens. So I won't touch spinach with a 10-foot pole or lettuce. Can you eat lettuce? Yeah, I can't eat lettuce at all. All right, let's go back to Facebook here. I'm going to have to take a bio break in a minute. My bladder's getting a little bit full here. Carol DeSanio says, "I'm going to see Dr. Eckenberg tomorrow. First time you're at the hotel in Bethlehem. Awesome, hun. Please tell him that Jill from the IC Network said hi. Any advice? Yeah, go talk about your symptoms. Don't walk in and say you've been diagnosed with IC. Your ability to discuss your symptoms in depth is critical with somebody like him. Your goal is to get him to study your pelvic anatomy to try to differentiate what could be triggering your pain. Bladder wall, pelvic floor, nerves, spine, bones, estrogen levels, hormone levels, quality and health of your skin. You know, don't get a, you know, don't fall down the IC rabbit hole. You've got the national expert on pelvic pain that you are seeing. Give him an opportunity to examine your body and tell him everything, even the weird, embarrassing symptom that only happens now and then. Tell him everything. Also, tell him if you have any history of any traumatic events to your pelvis, any falls, anything. Jacqueline says, "That's exactly what I've been eating to increase my fiber, spinach." Gads. Yeah, no. Sweet. Can you eat green peas, hun? Green peas. Spinach actually is not, let's look at the fiber content for spinach. Hold on a sec. Um, Trying to remember the URL. There's this great website that the state of New York did. Let's see. Hold on. I know that a serving of green peas is 13 to 16 grams of fiber a day. Oh, guys, you think spinach is a great source of fiber? It's not. A serving of spinach is only 2.4 grams of fiber a day. That is not a good source of fiber. Peas is a much better source of fiber if you like green peas or look at beans. John says, please explain how to deal with chronic yeast while having IC. They require such different treatments. Tell you what, John, you know what, guys? Before I start squirming, I'm going to take a bio break. So let's take a group bio break. That's what we call it online in the streaming world. We don't say, I've got to go to the bathroom. We're going to take a bio break. 2 minutes. Everybody, run to the bathroom. I'll meet you back in a minute. All righty then. Okay. And hold on. I got to have a bite of yogurt. I normally don't eat on Sundays until I'm done. And that hasn't worked well for me. Okay. Now the sun is setting. The lights are weird. Now I look yellow. I have no idea why. See, if I were in a studio, this would not be happening. That's terrible. All right. All right. So John asked, I think, a critically important question, and that is chronic yeast. So why do so many IC patients have chronic yeast? Well, the first thing that we really have to consider is the fact that if there is ever a group of patients who are overtreated with antibiotics, it's the lower urinary tract patient. Because when you have symptoms of frequency, urgency, pressure, pain, almost everybody assumes you have infection. And most of us, myself included, before we were diagnosed with IC, we were given antibiotics. And for many people, we had one study, excuse me. See, that's what happens when I try to eat and talk. All right. We had one study of patients, I think it was like 50 or 60 patients who had taken antibiotics for 10 years. And when they did what they call a retrospective chart review. They went back into their charts. And out of those 50 patients, only 1 or 2 had positive cultures. Everybody else had negative cultures. And they had been taking excessive antibiotics for years. And when you do that, you kill the good bacteria that keep fungi in check, that keep yeast in check. You got to remember the human biome is this billions of living beings living in our body that are controlling each other. They just control each other. So bacteria keep fungus in check, this and that, this and that. And we, in our arrogance of mankind, do a lot of things with chemicals and medications, not understanding the long-term ramifications of those. And the long-term ramification of antibiotic use is you kill the predator to yeast, and that creates a foundation for chronic yeast. This and guys, hey man, you can't kid a kidder. I know some of you self-medicate. That what? Okay, now I'm green. What? Sorry, guys. Listen, I do bladders. I don't do lighting so well. Red? Is that better? Okay. No, I'm green again. Okay. Well, anyway. Sorry. Hold on. This happens every time the sun changes. And I have a new light. I just haven't set it up yet. Oh, well, it is what it is. So some of you self-medicate. And some of you take antibiotics like candy. And you can't lie to me. I know you do. I know you do. And you have to understand the consequences of that. That is dangerous. It is dangerous because you are creating the perfect environment for drug resistant infections and, more importantly, out of control candida. So and it's not your fault. We were all overtreated with antibiotics when we were younger. I remember as a kid being told to swallow 16 pills of sulfa at once. Okay. We know better now. But you got to remember the bladder only knows one language: frequency, urgency, pressure, pain. An injury, a bullet wound feels like infection. Everything feels like infection because the only way the bladder can tell you that there's a problem is through symptoms of frequency, urgency, pressure, or pain. Alrighty, so that's concept number one. Concept number two is if you've been diagnosed with IC, the challenge here is that our IC diet, to be quite honest, is based on carbs. And people, especially if you're in pain, you go to comfort food, carbs. What do yeast love? Carbs. So there's a really good book called The Yeast Connection that I think has really, really, really good, valuable tips on how to control chronic yeast. I did the Fukuzata protocol back 18 years ago. And I was on amoxicillin for 6 months, ended up with a Candida glabrata, drug-resistant Candida glabrata strain. And it took 3 years to kill that son of a gun. It was the worst infection caused by antibiotics. And interestingly, it was burrowed into my skin on the outside of my body. And so we had, one diflucan wouldn't touch it. I mean, we did massive diflucan 7 to 10 days in a row, several times in that 3 years before we were finally able to kill it. But what really killed it was a discovery that we would kill everything on the inside, but we were missing the candida on the outside. They kept giving me the diflucan. They didn't give me the cream, the nystatin cream. And I remember I was at the urgent care one day, I thought I'd had a ruptured cyst. I mean, the pain was so bad. And the physician put me up in the stirrups. He took one look and he goes, "Oh my God, I can see the yeast burrowed in on your skin. Like little tiny burrows of yeast all over my vulva." I couldn't see it. He could see it under a microscope. And he goes, "Aren't you using the cream we gave you?" And I went, "What cream? You really didn't give me much of anything." And so in addition to the diflucan, what they ended up doing also is giving me nystatin cream, and it was killing the yeast on the skin. That was really, really helpful. But the other far more important thing that was helpful was to stop feeding the yeast. And that's what the book, The Yeast Connection teaches you, is that yeast need sugar to grow. And so what they have you do is cut way back on your carbs and way back on your sugar. And reading that book is really enlightening because you're thinking, okay, well, I don't eat candy bars, I'm fine. But a lot of people don't know is when you eat pasta, that pasta in your mouth is almost immediately converted into glucose and is equivalent to eating a candy bar. And so, and I know for me during that period of time, John, I will tell you absolutely every time I ate ice cream, I had a yeast flare. The candida love milk sugar. And so I had to cut way back on my carbs and way back on my sugar and eat much more healthy, and then attack the infection where it was, which was burrowed on my skin. And the thing that really triggered my yeast infection, aside from the antibiotics, was sitting on heat on a heated chair cushion. That's really what triggered the growth on my skin there. Not to be, I have no shame. I'll talk about anything. So that's how I got mine. So I hope that helps. Rhonda says antibiotics are bad. They are not the answer, but I would love to have the biotics to go to if the bladder, if needed. Yeah, but how do you define if needed, Rhonda? How do you define if needed? And then how do you know if the antibiotic you have is going to kill that infection? I mean, you could do a urine strip test, and you could pee on a strip, and if it tests positive for nitrates, then yeah, you've got infection, because nitrates are only produced by bacteria. But the problem though is you don't know what that bacteria is resistant to. So you might have some Keflex or sulfa sitting around and take that, but it's a guess. Ultimately, in the end, if you think you've got infection, you've got to have a urine test. And ultimately, in the end, typical urine testing is not specific enough. We now know that a typical 24-hour urine culture misses the vast majority of bacteria out there. So you could have a next generation urine test, which might take a week or two. I mean, you're kind of damned if you do and damned if you don't. I mean, if you do, you're running a risk. If you don't and you have infection, you're running a risk. And we're all kind of in a pickle. It's a bit of a pickle trying to figure out what to do. I think ultimately for me, it's about what are my symptoms. Bladder infections have very, very specific symptoms. And so aside from frequency, urgency, pressure, pain, what you notice when you have a bladder infection is a lot of urethral pain and fever. So if you've got fever and then you dread peeing because your urethra is going to scream, then the odds are you probably do have some sort of bladder infection. And that's when you call your doctor, get in, have a urine test, do a UTI kit if you have one, and follow that journey wherever that is. Alan says, what's safe for chapped lips and lips that peel? Well, number one, Vaseline is the safest thing of all. I use Alba lip balm, coconut cream. And then I use Bliss Stacks in a tub. Those are the ones that work the best for me when I'm outside and I want sunscreen. So you see me using it several times because my lips get dry talking like this. Kristen says, oats make my mouth feel itchy. Yeah, I can't touch oats with a 10-foot pole. Oats really bother me. If I have oats, I get the headache. I get very irritated, and I have terrible bowel spasms when I eat oats. So oats are one of those foods that some people just don't react to well, and I'm one of them. And I've met many IC patients who have issues with oats. When the book, where is it? I have it here. Hold on. Where is it? Oh, here it is. So, the first book that really kind of talked in depth about grains and gluten intolerance is a book called The Better Bladder Book by Wendy Cohen. Now, this is an older book. You could still get it on Amazon. We actually have another new book that's coming out soon. Um, um, but she is the one who talked. I mean, gosh, what are the chapters in here? I've got all this highlighting in here. So the chapters in here are a new approach to bladder and pelvic pain, understanding the basics. Now this was written in 2011 before the subtyping, so she doesn't talk about subtypes at all, et cetera, et cetera. But what's bugging your bladder, the role of food sensitivity, food allergies, sensitivities, and intolerance. And she's the worst who really talked about gluten intolerance. Now, gluten sensitivity in the bladder and lectins and recovery on a gluten-free diet. And I think that it's worth a try. Like I know for me personally that I do better going gluten-free. You're not going to see me eat a lot of white flour. You're not going to see me. I eat gluten-free pancakes. I like to make gluten-free muffins. Um, I feel better gluten-free. I do Ezekiel bread, which is not overly processed. It's not an overly processed wheat product. Um, I tested negative for celiac. I did. And so that's something that you could try for a couple of weeks and see if going gluten-free makes you feel better. It might, and it might not. But there's no reason for everybody to go gluten-free. I mean, I made persimmon cookies yesterday with regular flour. I ate them, I was fine. I just know for me personally, I don't like to start the day with cereal or with white flour pancakes or anything at all like that because I will just be very bloated and gassy all day. Gluten-free feels better. I also don't eat regular pasta hardly at all. I usually only eat quinoa pasta, and that's much better for me personally. Joan says, should I still have a bladder scope occasionally if I'm going to a pain clinic to control your pain? Well, a bladder scope would give you evidence that you might need it. If having a hydrodistension continues to find Hunner's lesions, and we know Hunner's lesions are very painful, that's powerful information that would go into your medical record to justify your need for pain medicine. But I would look at it very, very differently. The fact that you're going to a pain clinic means you've got severe pain. I like the idea of having a bladder scope just to figure out why you're in such severe pain. I was working with a patient again on Thursday or Friday of this week who was being taken off her pain meds, and we were talking. It's like, okay, I understand that, but I want to look at this a different way, and that is, wouldn't it be nice to know what's triggering your pain in the first place so that we can address that, so maybe you won't need the pain meds as much. And her case was really, really interesting because she did not her pain started at like the age of 60. She was 65. Um, they had given her hormone cream. She'd never used it. She didn't understand why it was important. And she was clearly a case of pretty severe estrogen atrophy. And it took a lot of time with her to explain how these things worked, and what I hope I was able to do was help her understand that yes, some patients need to be in a pain clinic, no doubt about it. Absolutely. No, I mean, I chaired our state pain conference here in California. I get it. I know. But half of that journey also has to be to try to figure out why you're in so much pain so that we can try to figure that out. And that was something she just did not understand. She never asked, what is causing this pain? All she said was, I was in severe pain and they sent me to a pain clinic. It's like, okay, why? She goes, well, I was in pain. It's like, okay, what did they say about what could be triggering your pain? She was like, I don't know. It's like, okay, we need to figure this out. And through a lot of questioning, at the fact that her pain started at the age of 60, her skin was very, very dry. There were a couple of other, And then the other thing that was really interesting about this case is that um, um, the worst pain was as she was peeing. She didn't really have bladder pain. It was all in her urethra. And I asked her, I said, okay, so when you're peeing, your urethra screaming, is your vulva screaming? And she's like, oh, yeah, it is. And I'm like, okay, so is your urine hot? She goes, yeah. I said, hun, that's estrogen atrophy of your vulva. And then and it's like, how old are you? 65. Okay, this started at 60. Okay. Has anybody looked at the quality and health of your skin? Well, they gave me estrogen, and it's like, did you use it? No. Why? Because I read on Facebook it was bad. It's like, no, 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 no. Wait. And it was such an interesting case to me. And so, Joan, that's what I want you to do too, is I really want you to look at this also as an opportunity to revisit what is causing your pain. Because in her case, she was using a lot of fentanyl and they were cutting it way back. And from an anatomical perspective, her symptoms were really logical, and she had all the hallmarks of really extreme estrogen atrophy, genitourinary syndrome, and menopause. So I sent her back to her gynecologist to get that checked out. So, hello, Gail. Gail Ben Shabbat just joined the group. Gail is one of the new co-chairs of the new Canadian national nonprofit for interstitial cystitis. I don't know if you're actually formally organized as a nonprofit yet, but hallelujah, we've got two people, Gail and Marnie up in Canada, who are now starting a new national Canadian group. And I do believe they have a group here on Facebook. And Gail, please feel free to link it. We have been waiting for a new nonprofit in Canada for a decade. Chris says, I have found an estradiol suppository compounded with olive oil rather than a cream. Apparently seemed to help that the cream seemed to irritate your vulvodynia, I think due to the alcohol. Awesome. Awesome. Sylvia says, is turmeric a bladder irritant? I want to take it for neuropathy. Hun, this is one of those things where you've just got to try it and see how you do. Somebody asked me that question yesterday, as a matter of fact. I don't really have a good answer for you. I do not have a good answer for you at all on that. Let's do a survey. Everybody out there, can you take turmeric and do you flare from it? I don't usually eat turmeric. Christine says, I use fragrance-free and alcohol-free baby wipes after urination and bowel movements. Christine, I think that's a mistake. I don't think you need to use those after urinating, because when you're using a wipe on your vulva, you're exposing your vulva to a chemical. And that's something that you can find in the book, girl. The book you got to get is this one. You can get this on Amazon right now. The Vagina Bible. In fact, I gave it to every woman in my family, and my nieces-in-law were rolling their eyes at me going, really? And I'm like, yeah, really, it's good. Check it out. The Vagina Bible. This has a really good section on cleansing, Christine. Really, really, really good section on cleansing. I think that using that after urination is completely unnecessary when you can just rinse yourself off with water and pat dry, and you're not introducing any harsh chemicals onto your skin down there. But messy bowel movements are another story. I mean, I think it makes sense for messy bowel movements, but you wouldn't normally rub it around your vulva, right? I like Preparation H wipes. I think they're fantastic. With witch hazel, they're really good. Those are the ones I use. Hello, Sarah. Louisa says, I feel symptoms of vulvodynia the next day after I take Preleaf. Well, that's really interesting. Do you ever feel symptoms of vulvodynia after any other foods? I guess the only thing, so some people with vulvodynia are very sensitive to oxalates, and they find that foods that containing high amounts of oxalates, like berries and chocolate and spinach, can trigger irritation of the vulva. So I wonder if there's some sort of byproduct from the pre-leaf that could be doing that for you. Although I mean, that's the first in 25 years I've ever heard anybody say that pre-leaf has ever triggered vulvar irritation. I don't get it, but I believe you. I mean, we're all unique. Christina says, I would get rid of all your bounce sheets. Yeah, hallelujah. Throw those away. Christine says, I have irritable bowel with frequent normal stools. I sometimes go 3 to 5 times a day. That's okay. Peribottle. Peribottle is a way to go for cleanliness. The peribottle is going to get far more bacteria off of your skin, especially if you've got hemorrhoids, because there's a lot, you know, listen, I care for a 90-year-old mother who's had 3 children. And hemorrhoids are real and they are challenging, and cleaning around them is hard. But when you use a peri bottle, you have a much better chance of washing things off. So at least use a peri bottle first, rinse it off, and then for the back end, use what you need to use. I will just say that cottonelle is kind of notorious for causing a lot of irritation. So pick something that is chlorine free, that's not cottonelle, or go for the preparation H wipe. Try the preparation H wipes, Christine. You might really like them. I love them. They work well for me. Sue says, depressants triggered gastroparesis along with heart issues that sent me to emergency. I had heart issues from antidepressants too. I don't know about I believe you. I don't remember if antidepressants triggered gastroparesis or not. I believe you though, totally. John says, "Can I?" Oh, you're going to Carol. Okay. Elaine says, "If I don't get antibiotics, I get recurrent UTIs. It's a no-win situation." Well, no, Elaine. What we have to ask is, why is your body vulnerable to recurring UTIs? If you're over the age of 50 and you are perimenopausal or menopausal or postmenopausal, you have a much greater incidence of becoming, of being more susceptible or vulnerable to infection. Why? Because with the loss of estrogen, your thick protective coating that normally acts as a barrier to prevent bacteria from attaching to the cells in your bladder is diminished. Woo! That is bright. Holy moly. Is that going to do it? Let's see. Yeah, oh, no. Oh, let's see. I know it'll work. Let me just move my project board over there. There you go. That'll work. Okay. All righty then. Okay, so Elaine, so I attended a really good lecture at the American Urology Association conference about recurring UTIs in women. And it was taught by Dr. Anthony Schaefer, who's a very famous urologist it's somewhere in the Chicago area, somewhere like that. And the first thing he said is, they never, ever, ever would diagnose a patient like that with a simple UTI. It's always considered a complex situation. And so there have been many, many research studies to understand why women get recurring infections over and over and over. And literally in these studies, they like take urine every day. They do vaginal swabs every day. They do they have worked so hard to try to figure out why women get recurring infections. And inevitably, what they discovered is that 24 hours before that patient had a bladder infection, that bacteria was first found in the vagina. And so that then led to the question of, well, what happened to the vagina's ability to defend itself? Why isn't the vagina defending itself? And why has it become a safe haven for bacteria? And the answer also comes right back to estrogen atrophy. And that is just like the bladder loses mucus, so does the vagina. The vagina loses mucus. And as a consequence, it cannot defend itself from bacteria either and becomes kind of a safe hiding place. And so, what he said is in general, these women, unless there's another issue going on, in addition to being given antibiotics, they are also given an estrogen cream to improve your skin health. And that without doing the estrogen cream, you're not fixing the fundamental problem, which is your skin's ability to defend itself against infection. Now, the other thing you want to think about too is there something in your daily life that keeps reinfecting you? I always tell patients who get recurring infections, I make sure they identify the bacteria. Is it E. coli, staph, strep? And try to go back a year and look at the trend. Is it always the same bacteria over and over and over again? Or is it mixed up? Is a staph one, enterococcus another, E. coli another, right? If it's the same bacteria over and over and over, what that means is that you probably have a drug resistant bacterial infection that is simply not being killed by the antibiotic. And you would want to do something like next generation urine testing to that looks at drug resistance genes and will give you much better, more accurate recommendations of which antibiotic to take. But if it's different bacteria over time, that speaks more to your physical health. And that speaks more really honestly to menopause and skin health. What it means is that your skin really is not able to defend itself as well. And it also potentially could imply an autoimmune disorder of some type. So I think it's time for you to not just take the antibiotics, but also to try to understand why they're occurring. And I would bet, depending upon how old are you, hon? Wendy, what is an alternative to amitriptyline? Off the top of my head, well, you got amitriptyline, imipramine, nortriptyline. Those are all anticholinergic medications that have also been linked to cognitive decline and dementia. So you need to talk with your doctor about a non-cholinergic medication to reduce that risk. I personally never found a low-dose antidepressant that I could take. I had issues with all of them. But again, redhead, sensitive, that's me. Dawn, I've been prescribed Cipro 8 times. Oh, girl, you are a success story of success stories. I have been prescribed Cipro 8 times in the past 2 years. It was only once I found your site that I learned about food triggers. Coffee, sugar, alcohol were my triggers. I was over medicated and only had an infection once. I am now trying to heal my bladder. Grateful for you. Dawn, thank you for sharing your story and more importantly, giving us an opportunity to talk about Cipro, which has very, very severe warnings now. The FDA issued an alert, yet another warning after many, many warnings, that Cipro is no longer recommended for simple urinary tract infections because the risks outweigh the benefits. That Cipro has now been linked to some very, very severe adverse events, even in healthy people. They call it being floxed. And so there are some people who have taken just one prescription of Cipro who have lifelong illness from it. And I did a big article on it in our magazine. Which one did I do it in? Let's see. Oh, I have so many magazines. You guys, seriously. Did you know that the IC Network has a magazine? It's called the IC Optimist, and you can become a member of the IC Network and get our magazine for just $25 a year. It's pretty good. I like it. I love writing it. We have a wonderful team of writers and doctors who contribute to it. And so, if you want good information, this is our winter issue from last year. Please sign up. Okay, I have an article in one of them, in one of the last 4 issues, called "Have You Been Floxed?" and it's all about Cipro. And so, for those of you who are members, go back to your old magazines and take a look at it. Because, Dawn, it's so important that you never do that again. And you should print out the FDA warnings on Cipro. You should take it to the doctor who made that prescription. And it's sad that it's the patient that has to be proactive here. But in this case, you have to be really, really proactive. But I'm so glad you found us, hon. And I'm so glad you're feeling better. Joan Ball said nothing else worked. Well, I hear that nothing else worked to treat your pain. I'm not criticizing that in any way, shape, or form. It's what you had to do. But we still have to figure out why you're in pain. That's still a big part of your story, hon. You are an anatomical mystery to be solved. Could you have fibroid tumors? Could you have endometriosis? Could you have pelvic congestion syndrome? Could you have something attached to your bladder? There are lots of things that can trigger the symptoms of IC and trigger pain that are treatable. And they haven't found it yet. And at some point in time, I mean, that's the question you have to keep asking over and over and over. It's the question is not, can I have pain meds? The question is, why am I in pain in the first place? And when you ask that question, you demonstrate that you're not a drug seeker. You're demonstrating that you want to get to the root of the problem. Well, then if they only looked at your bladder, it's time to look beyond your bladder, hun. Remember, the American Urology Association guidelines for IC are crystal clear. If you are not responding to treatment, if you continue to suffer with pain and or your pain is worsening, it is time to revisit the diagnosis. Because if think about Sue, who was in here earlier, for 30 years she had bladder pain. Every bladder treatment failed, and it was only until they did an MRI that they found this giant gob of scar tissue down in her pelvic floor that is the source of her pain. So just because one doctor couldn't find it, that doesn't mean that other doctors can find it. Especially, you at this point in time, given the fact that you're at a pain clinic, that tells me that your pain's really severe and you deserve the best care available. You're not just pain relief, but let's figure it out. I mean, you could be like that internal medicine doctor who had a stitch through her bladder wall. Or you could have endometriosis bound to your bladder wall that's tight and pushing on it. You deserve an answer to that question, but you've got to ask that question to try to get your answers. I just built a whole new section on our website. If you go over to the IC Network, icnetwork.org, and you go to the first pull down menu, which is interstitial cystitis, go to diagnosis, and a big new window will pop up that says confusable conditions that will mimic the symptoms of IC. I want you to go there and look at all of those conditions. And there's more I haven't even added yet. It's time to work through them one at a time. Is this possible? Is this possible? Is this possible? Is this possible? You know? And you're welcome to call me too, hon. I mean, I'm more than happy to talk with you on the phone, see if we can figure it out because I know you're in a really, really difficult situation because because pain care has been helping you and they're threatening to take it away. You should also really think of maybe about trying Peora, the supplement that just came out. Peora is palmitoethanolamide, and we just had it's been used in Europe for more than a decade for chronic pain and neurologically driven pain. We just had our first ICPEA research study released, which found that uh, every IC patient who took PEA had a significant improvement in their symptoms at 6 months, and 25% were pain free. At 3 months, 87% had a significant reduction in their symptoms. So, Peora might be something worth trying too, especially if what they're proposing isn't helping you as much. I mean, there's research behind it. Allison, I normally wake about every hour at night to pee, but after the first hour of going to bed, I wake and get up every 10 to 15 minutes because I get a spasm like pain. Okay. Okay, so girl, that's exactly the way my flares happened. So let me explain here. Let me explain what is happening there. So, um one sign here, hold on. One sign that your bladder is really, really irritated is a false sense of fullness where your bladder feels really full, even if it's empty, right? So the flares that I used to get are exactly what you just described. So I would here, hold on, my hair is weird. Um, I would go to bed and I would wake up an hour later and my bladder would feel really, really full. And I would go to the bathroom and I would pee out maybe a quarter cup of urine. I'd go back to bed. I'd wake up 15 minutes later. My bladder would feel very full. I'd go to the bathroom. I'd pee out maybe a teaspoon. I'd go back to bed, try to sleep. If I slept, it would be a couple of minutes. If not, I had urgency. I would go back to bed. I would go back to the bathroom. I'd sit on the toilet and push and push and push and get a drop. And then I would be stuck in this false sense of fullness all day, all night. And that ultimately is a sign that the bladder wall is extremely irritated. That's what happens after a really bad diet induced flare. And that happened after I was at the movies and I had a 7-Up, and it was before I knew about the diet, and I just wanted, oh, it was terrible. And the way I got through that is I had to get out of bed. I had to grab a big heating pad. I had to take a little bit of pain medicine and go lay on my family room couch, turn on the TV, and just drowse and try to doze. You found a system that worked for you, and that is you took the ibuprofen with a slice of bread. So the ibuprofen, that's really a really cool success story. Because what that's showing is that your bladder is responding to a simple over-the-counter pain reliever, which is the ibuprofen. And in my case, um, I'm trying to remember. I took Advil a lot until it blew out my stomach. And then Tylenol. Did I go to Tylenol? By that point in time, my pain was so severe that what I would do instead is take like a quarter of a Norco. And that would allow me to doze and try to get through that night. But anyway, you described a bladder wall flare perfectly, perfectly. And I'm really, really glad the ibuprofen helps. And people, that's a good lesson for you. That's a the only thing you would change is maybe how about taking the ibuprofen before you go to bed? And maybe you can minimize a lot of that. Take one ibuprofen before you go to bed, maybe, if you're not sensitive to it. So Elaine says the doctors are suppressing your estrogen because of stage 4 endo. They're now trying Rimso to control. Elaine, have they tried a rescue yet? Have they tried a rescue installation, heparin lidocaine or Elmeron lidocaine? Here, hold on. Okay. And again, the supplements for you, something that would provide a bladder coating effect might be really helpful. I mean, if Elmeron, again, pretty much off the table. For those of you who don't know, it's worth going over again. So we know Elmeron's been associated with eye disease, retinal disease, pigmentary maculopathy. And if you look at one of my last streams from before Christmas, we had very tragic news. And the tragic news is that we now have our first case study from Harvard Medical School in one patient who showed that the eye damage was progressive after they stopped the medication, that her eye issues continued to worsen and worsen and worsen. And it's a very interesting case. Let me just kind of I've got it. Let's see. Where is it? Here it is. So with the Elmeron situation, so please remember that we didn't learn about the Elmeron eye issues until researchers from the Emory Eye Center in Atlanta sent a letter to the editor to the Journal of Urology in the spring of 2018, stating that they believed that they had found a new disease associated with Elmeron use, a new eye disease. Fast forward 2 years, and not only has that been confirmed, but now ophthalmologists around the country are reporting cases. We have our first population-based study done in California, because remember, ophthalmologists, every doctor has cases that bug them, cases where they really wanted to help a patient and they couldn't, right? It's a failure in their eyes, so they're always thinking about this patient. I couldn't help Jill, why couldn't I help Jill, et cetera, et cetera. And so a doctor at Kaiser Permanente in Oakland, California was really intrigued by the Elmeron data, and he did the first clinical survey where he went into his current caseload, found 140 patients using Elmeron who had used Elmeron for 5 or more years and were actively using Elmeron. He sent them all letters. Would you come in for an eye exam? 91 did. And out of those 91, 20% had Elmeron-induced eye damage. So that 20% figure now, and the limitation of his study is he only looked at patients who were currently using it. He didn't look at patients who had stopped using it, which is going to blow it wide open. The same thing happened at Harvard Medical School. Harvard Medical School, an ophthalmologist there had a patient that they could not help, and they were stymied and frustrated. So this was a patient who, at the age of I think she was 62, first went to Harvard Medical School because she had a problem in one eye. And when they looked at the eye, they really thought it was a toxic exposure. It's called, what's it called? The findings raised suspicion for a toxic etiology, but there was no history of exposure to known retinotoxic agents. So they sent her on their way. I mean, they ruled out genetics, they ruled out other things. They just couldn't figure out why her eyes were failing. So that was 8 years ago. Well, she came back 6 years later at the age of 68, and now it was in both eyes. And it was really bad. It was getting bad. And again, they ruled out everything else. They ruled out genetics. They really had no explanation for why her eyesight was diminishing. Then she came back a year or two after that. And it had progressed terribly. And again, Harvard couldn't figure it out. So they sent her on their way, of course, with all their whatever good meaning advice they could offer. But this case stuck in this ophthalmologist's head. It's like, what is wrong with this patient? Why is she going blind? And then Emory published their data. And this doctor at Harvard went, wait a second, she was an IC patient, pulled her record, taken Elmeron for 18 years. And she did the same studies that Emory did. And I've got pictures. So left eye, right eye, and this is over time. So at her first visit, this is what her eyes looked like. So you could see spots building up on her retina, right? This is 6 years later. Look at these spots. They're much bigger. They're much more fragrant. 8 years later, it's almost a solid mass of damage. Here's the pickle. She stopped the Elmeron after this appointment, 1 year after this appointment. And so what this showed is that her eye damage progressed over time, even though she had stopped the medication. And they compared it to another medication called there's another medication. The name is on the tip of my tongue. Here's another. This picture is really interesting. So this is a kind of a three-dimensional view of the retina. And again, left eye, right eye, first appointment, second appointment, third appointment. And you can see the cells in her retina changing, the colors in the cells changing over time. And this is exactly what the doctors at Emory saw. So what is the name of that other medicine? Oh God, the name, it's just right on the tip of my tongue. I hate it when that happens. Now I just sent somebody a whole bunch of links to this, and I specifically mentioned it. Here it is. Plaquenil. Plaquenil is a medication that is also known for causing progressive eye damage even after the medication is stopped. So this is just one patient. I'm telling you, Emory now, thanks to a lot of you stepping forward and volunteering for studies a year ago, Emory is now finishing up a 1-year study to also document if it's progressive in a larger group of patients. But this is heartbreaking. It's infuriating. We have attorneys circling now looking for patients for a potential class action suit. The attorney that I have been talking with called me, like, I think 2 days after I did our study because his wife has IC and took Elmeron. And his name is Michael Jansen. He has a website, elmeronidisease.com, elmeronidisease.com. If you have taken Elmeron and you have eye issues, you can call him and participate in their survey. Also, we're looking for Canadian patients who have taken Elmeron who have eye damage because Canadian national TV is hoping to do a story next week on this and they want to interview patients. So if you are in Canada and you have confirmed eye disease from Elmeron or you suspect that you have eye issues from Elmeron, please send me an email, icnetwork@mac.com. That's M as in Mary, A as in Apple, C as in Charlie, mac.com, so that I can refer you to that reporter who might want to talk with you. Okay. John says, "What do you take if you're allergic to almost every antibiotic? Cipro scares me. Levaquin." Well, that's the wrong question. You don't choose an antibiotic based upon your allergies first. You choose an antibiotic based upon antibiotic sensitivity testing, because it's all irrelevant until we know what classes of antibiotics will actually kill that infection. So it doesn't help to ask that question first. What we have to know is, what is that bacteria vulnerable to? Which classes of medications is it vulnerable to? And then based upon that data, then you can pick and choose antibiotics. Laura says, my doctor prescribed a cream to use externally that has amitriptyline in it. Would that have the same side effects as when taken orally? No, no, really not. No, topical medications tend to stay in that localized area. They don't normally go systemic to any great degree. That is why topical estrogen is considered much more safe than oral estrogen. She probably gave you an Omibach cream, which is an amitriptyline baclofen cream. So you've got the amitriptyline combined with a muscle relaxer of the baclofen. Is that what they gave you? It's a good compounded cream. There are several different types of compounded creams that can be used on the vulva that can help reduce nerve pain. Angie was responding to John and saying, have you tried or can you take amoxicillin or augmentin? John, amoxicillin and augmentin are very, very harsh and aggressive and can be challenging. Augmentin is a beast of a med. And so again, you want to make sure you have your antibiotic sensitivity testing done first. It'd be a shame to take a medication like that could really mess you up when there might be another one that is not as brutal. Brenda says, Peora is an absolute godsend for me, and I found my Norco were causing more pain than they were helping. Yeah, baby. Woohoo! Another success story. I'm so excited about Peora to be able to bring this to United States, and it's so affordable. It's like $29 for a month's supply. It's amazing. And the fact that it can help people with pain, not everyone, but some people, I think it's worth a try. What Elaine says, what is a rescue? A rescue, it's called a rescue installation because it can rescue you out of a flare. So a rescue installation is usually a bladder coating combined with an anesthetic. So it's either going to be heparin or lidocaine for a bladder coating combined with either lidocaine or marcaine to numb your bladder wall. And so normally when you have a rescue installation, you're immediately pain-free for a couple of hours and you walk out feeling good. Some people are lidocaine intolerant and they have reactions to it and they have to switch from lidocaine to marcaine. So there's no way to tell in advance if it's going to work for you, but it is right now the most common therapy used for IC and IC flares around the world is a rescue installation. Please come on over to icnetwork.org and go to our IC treatment section, and I've got all the information there along with the formulas that are often used. Brenda says, I'm still having pelvic pain and discomfort, but my bladder is much happier. I love that. Tiffany says, what are my thoughts on kratom for pain management? I would say that kratom is considered pretty dangerous. We've had a couple of pretty big FDA alerts. There are numerous, over 100 fatalities from kratom. I would be doing Peora first. Hey guys, hold on one sec. I'll be right back. Hold on. The sun is setting. Yeah. So kratom honestly can't support it all. If you Google kratom FDA, you can see the warnings. There are, I think, if I remember correctly, something, it was either like 117 or 170 proven fatalities from kratom. So I'd be really careful with that. Peora, on the other hand, has been studied in research studies as a very, very, very small side effect profile, and it's been proven in research to help with the pain of IC. So I would put Peora way ahead of kratom. Angie says, I love my Parsons rescue installations. My doctor also adds sodium bicarb to reduce acid, and I think it helps the heparin adhere better to the bladder. I do them myself. Actually, what the bicarb does is by alkalinizing the solution, it helps it pass through the bladder wall and get deeper into the tissue. So adding that little tiny bit of bicarb, you never add more because you can overdose. It's a little tiny bit of sodium bicarb can be very helpful. In pregnancy studies, a recommendation for women who are pregnant is to not use the bicarb because we don't want it penetrating to the fetus. That's a whole nother story. We have a pregnancy resource center on our website. Using any medications during your first trimester obviously is not recommended. But we do have one research study which compared, or one research paper which looked at typical IC therapies with respect to pregnancy risk, done by Dr. Deborah Erickson at the University of Kentucky. And so if you're considering pregnancy or you are pregnant, you want to know that, go over to our pregnancy resource center and you can get the link to it and then do what you need to do. I can't give you the paper because it's a paid for paper. I just summarize the results, but you can actually buy the paper yourself and give it to your doctor. Rhonda says, wow, Angie, I could never give myself bladder installs. It's great that you can. So, my friends, as I see patients or anybody who struggles with tight pelvic floor muscles or urinary retention, one of the best skills you could possibly ever have is learning how to self catheterize so that you always have an out. You know, why do things always happen on the weekends, right? If it's going to happen, it's going to happen on the weekend when nobody's available and you don't want to go to the emergency room, and you can't pay, being able to self catheterize is a fabulous skill to have in a crisis. And it's remarkably easy to do too. Oh, so Angie says a home health nurse came and taught her how to do it. Cool. Joan says, how can you reach me? If you go over to our website, IC Network, and down at the bottom, there's a contact us page. You can send me an email through that. Rhonda says, diet is a big player in IC. I believe I have that. Yeah, diet's huge, huge. If you got IC subtype 1, subtype 2, Hunner's lesions, or bladder wall driven symptoms, yeah, diet is critical. Guys, we've been at this for 4 hours. Holy moly. Marlon said, I took Elmeron for years, had remission, now put back on Elmeron by a different doctor. I had a lump removed from my right retina 2 years ago. Now very alarmed. I also have SLE and have begun Plaquenil. Oh, girl, holy hell. No, 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 no. You have got to talk to your eye doctor. Plaquenil, You got to talk. Listen, you got to be really careful right now. You've already had a lump on your retina. You're on the 2 medications known to mankind to cause progressive eye damage. This is not a viable medication alternative for you, in my opinion. I think it's a dereliction of duty for anybody to suggest to you that you should be taking both of those medications. You need to call your ophthalmologist immediately and bounce this off of your ophthalmologist. Call your urologist. Make sure your urologist knows that Elmeron has now been linked to progressive eye damage by Harvard Medical School, and they need to give you another bladder coating instead. You are a perfect case for trying one of the supplements instead. I mean, these also have a bladder coating effect without the risk. So you've got, first of all, you can get Cysto Protect in Canada. It's the cheapest in the world in Canada. You can get it for $39 US at Argonaut.com. They're only allowed to sell it to Canada. They can't sell it in the US. And it has a different label than this. This is the American version. But you can buy international Cysto Protect, which has a well-known bladder coating effect. In fact, the research for this was published in the Canadian Journal of Urology years ago. Okay, so this would be a much more viable option for you than to take something that could affect your retinas given your current situation. Cysto Renew is another one. Bladder Builder is another one. Bladder Rest is another one. Okay, but you got to be your own advocate here. That is a not viable combination of medication, in my opinion. And I don't know any ophthalmologist who would support that, given what we know now. So in this case, you got, your eyesight is far more important than your bladder at this point in time. Okay? Hey, listen, if you want to email me, icnetwork@mac.com, I will personally email you journal articles. I've got them right here because I just sent them. I just sent these. Oh, wait a second. I just sent all these to the reporter for Canadian television. Marilyn, if you give me your email address, you email me, I will connect you up with her also. Because this is reckless. This is reckless prescribing, in my opinion. You have a retinal lump removed. Somebody puts you on Plaquenil and they put you on Elmeron. This is not good. So I will personally email you the journal articles that you can give to the urologist and you can give to your ophthalmologist, because we got to protect your eyesight. And the good news is you just started. So, the odds of issues are very, very low, but let's see what we can do to protect you in the future. That's stunning. Stunning. Wow. Whenever I do this, I'm saying I'm giving you a hug and I'm sending you a hug because that's infuriating. I'm infuriated on your behalf that you're in this situation right now. Angie, you say you only use 3 ml of sodium bicarb, but you got to remember that sodium bicarb comes in different dilutions. And 3 ml at a stronger dilution could still be bad. So it's not just looking at the quantity, it's looking at the strength of the sodium bicarb that's going to matter here. Jean is asking about Dr. Malone Lee, and this comes up at every meeting multiple times. Here, hold on a sec. Obviously, the sun's going down here. So the problem that I have with I've got a couple of issues with Dr. James Maloney, his theories, and they make very broad statements that every IC patient has chronic embedded UTI, and that is absolutely not true. We have something called subtyping. We know, as an example, that some patients have Hunner's lesions. Hunner's lesions have now been connected to viral infections, not bacterial infections. We have a lot of estrogen atrophy patients whose symptoms are being driven not by bacteria, but by estrogen atrophy. Our biggest subtype are muscle injuries. And the fact that muscle therapy cures some patients tells us that they do not have chronic infection. We have nerve injuries, pudendal neuralgia. We've got central sensitization. So we've got kind of 5 core subtypes for interstitial cystitis that we're working with. And then inside those core subtypes, we've got subtypes. So the place where infection applies really is in IC subtype 2 bladder wall driven. So if you have pain as your bladder fills with urine that is relieved by urination, that tells us your symptoms are being driven by your bladder wall. So if the fuller you get, the worse you feel, then that's an issue. As soon as you pee, you feel better. That's all pointing to the bladder wall. So now we have to try to understand what's going on with the bladder wall. So with the bladder wall, we're going to look, number 1, at estrogen atrophy. Number 2, we're going to look at chemical irritation from chemotherapy or ketamine. We're going to look for any radiation damage. We're going to look for acute infection, but we're not just going to look for bacterial infection. We're going to look for fungal infection and viral infection, and then, of course, chronic infection. Is there a subset of IC patient with chronic infection? Oh, yeah, but it's small. It's not everybody. But do I think that some patients have chronic UTI? Yeah, I do. But the other challenge with Dr. Malone Lee right now is that that he doesn't believe in any testing at all. He counts bacteria or white blood cells with a microscope, and then rather than finessing the choice of antibiotic based upon drug sensitivity testing, he kind of blasts with antibiotics for a long time. And we don't know yet the ramifications and the damage that that has the potential of doing. We just don't know. And so, in this era of antibiotic stewardship, in this era of hospitals trying to minimize the risk of antibiotic resistant infections, you're really not going to find very many doctors who are going to support his suggestions. I think that there's one in the United States. Joan says, where can you buy Pura? Right there, icnetwork.org. We are the exclusive provider. I hope so, Jean, I hope that made sense. I'm open to it. We're the only IC group talking about it and giving it a voice. I just completely disagree with anybody stating that every IC patient has chronic embedded infection. Subtyping works. Some patients are being cured right now with subtyping, especially if you've got pelvic floor driven. All right, let's go down to YouTube here. Lydia says, have you ever discussed the role of oxalates in IC? Yeah, many times. If you're talking about oxalate levels in urine, yeah, for some people are absolutely sensitive to oxalates in urine. And the first person who ever talked about that was Beverly Lauman in this book. So for any old timers out here, the first, and many would argue still the best book ever published on the IC diet is called A Taste of the Good Life. And it is currently out of print, and she is retired and she is not reissuing it. Bev and I are very good friends, and she wrote a column on our website, the IC Network website, called Fresh Taste by Bev. So you can still find a ton of her stuff over on the IC Network. But in this book, she rates every recipe, not only with respect to acid level, but with respect to oxalate levels. So we've known about the oxalates for quite a long time. And anybody who has this book, if this is gold, hey, listen, if you want to get rid of it, send it to me so I can donate it to another patient who cannot afford to buy any of the books. That's what, guys, seriously, for anybody out there, if you have any books that you just don't want anymore, please don't throw them away. Either donate them to your library or send them back to me so that I can give them to a low income patient. The only books that I'm really not interested in getting are the Along the Healing Path books and To Wake in Tears. I will not send those out. I don't think they're just not accurate books. Heidi says, did I answer your question about laundry detergent? Oh, what brands? Man, you know what? Uh, hold on a second, and I'm gonna blow your mind with the laundry detergent that I use. Give me 1 second, I'll go get it. Hold on. All right. This is your hint. This is my laundry detergent. Anybody know what that is? It's the Echo Egg. It's not a detergent at all. This comes from England. And this is, it's filled with some mineral pellets. I don't know if you can see, I don't know if you can see. Can you see the little white pellets in there? Um, so one of these with the, and you can refill it with more pellets, will last about 220 washes. And it washes your clothes through minerals instead. And it works really well. And so I do all of my whites and all of my general stuff in this. The only thing I notice is that the whites get a little bit um, not as crisp. And so I will rotate out once every 2 or 3 weeks. I'll use all for sensitive skin on my clothes. Or if I'm washing something new that I bought, I will always use all. I won't use this, especially something from China. Or if we're dealing with an accident situation, then I will use a regular detergent. But for those of us who are trying to reduce plastic and also get rid of all the toxic chemicals, this is recommended by the eczema and the scleroderma associations for the fact that there's absolutely nothing in this that would trigger some sort of chemical reaction. It's called the Echo Egg, and you get over 200 washes for like, well, we sell it on the, I mean, I'm so excited about it. We sell it on the IC network, and I think it's like $20, something like that. Let's see. Let me look. Oh, so it's called the Echo Egg. Oh, I took it off the slideshow in the front, but it's still there. Let's see. Maybe we sold out. No, there it is. $19.99. And I was just for myself, I had this really weird vulvodynia thing, and we were just trying to figure out why. And we learned it was a pudendal neuralgia, and it wasn't vulvodynia anyway. But I suspected my laundry detergent, and as I was researching it, I found the Echo Egg. And so this is kind of cool. You might want to check it out. $19.99 for 200 washes, and it's refillable, and you just buy more minerals. So Echo, ECOEGG. Okay. Patty says, what subtype does estrogen atrophy fit into? That fits into subtype 2, bladder wall driven. Brian says, I'm taking buspirone and amitriptyline. Heard they have shown cognitive defects. Which should I take? Well, I think you need to go to your doctor and say, hey, I'm worried about cognitive issues. And I would like to take something that is not an anticholinergic at all. And see what your doctor is willing to suggest for you. It's a hard question. I mean, we've long known in research studies that people over the age of 50 who took an anticholinergic every day over a period of time dramatically increased their risk of cognitive decline and dementia. And then we had an earlier study which showed that even younger people under the age of 30 who took anticholinergics every day also started showing cognitive decline. And now we have another research study from England that came out last year that showed that if you were over the age of 50 and took a certain amount of anticholinergics every single day for 3 years, that increased the incidence of cognitive decline and dementia by 50%. And so there's a very, very strong move now to step away from anticholinergic medications, especially as you get older. And I know I got an email from Dr. Robert Evans. We were talking about that, and he was very clear in saying he tries not to prescribe them at all. Instead, you would do Mirbatrix instead of the Detrols, the ditropans for bladder symptoms. They like to switch you to Mirbatrix, which has a different method of action. It's not an anticholinergic. Unfortunately, it's just more expensive, and a lot of people can't afford it. And some insurance companies, this is one of the things he said to me that really frustrated him, the fact that the insurance companies will not pay for the Miratrick, which is safe, but they will pay for the medication linked to dementia because it's cheaper. We got a lot to do to clean up our healthcare in this country. Hello, Syed. Nice to see you. Allison says, "Will Peoria help with hunters?" No, it's not curative for what helps for hunters lesions are going to be hyperbaric oxygen therapy, Lyris, or a steroid injection into the center of the lesion, or cauterization. Peora acts to reduce pain. It would help a symptom of Hunner's, but it's not going to stop a Hunner's lesion. You have to have lesion-specific therapy for Hunner's lesions. So again, what are the therapies? Going from oldest to newest. Oldest number one is cauterization. If you just kill the Hunner's lesion with heat, symptoms improve. But of course, that leaves scar tissue. So the second step then is to inject it with a steroid, triamcinolone, which is also found to be as equally effective. And it doesn't leave scar tissue. So the preferred therapy really across the world is a steroid injection into the center of the lesion. Then we had Lyris, the lidocaine pretzel produced by Allergan owns it. Lyris is the first treatment in history to heal Hunner's lesions in 2 weeks, but unfortunately it was deprioritized by the company last year and it's not available. And then we just had new research again last year, which showed that hyperbaric oxygen therapy was remarkably successful at reducing the inflammation of Hunner's lesions. And I did an article on that in one of our magazines last year. So if you're a member, you can log on to your member page and reread that article. Guys, if you find these helpful, it's really great if you could support our work. And the way that you would do that is by becoming a member where you can get our great magazine. And our magazine is I write it. I write it, I edit it, and I have other writers who write for us. And the difference between us and anybody else, so we're patient. So we write patient-centric articles. We're not kind of in the clouds talking about, I don't know, irrelevant things. My goal with every article that we ever write for our website and in our magazine is that within 5 minutes you get something new you can try. It's about living life on a daily basis. What can we do to help? Like how we started this meeting with cold and flu strategies that are bladder friendly. Honey is the way to go. Honey products, throat drops, cough drops. Hello, Rosalie. Great. Kristen says, I experience bladder flares at night, just as you described. I discovered by accident that taking Alka-Seltzer before bed really seems to help. It contains aspirin and bicarbonate of soda. So I guess, it totally makes sense because you're alkalinizing your urine. and the odds are your urine's acidic and it would help. That's awesome. Kristen, I started taking Lyrica for pelvic floor pain about a week ago, and it's already helping my pain. I've also been using pelvic floor physical therapy and baclofen suppositories for over a year, so this was not a first-line treatment. That's good. So, Krista, you need to understand that taking Lyrica, I mean, it's absolutely a viable option. But Lyrica, once you start it, is pretty hard to get off of. It's called Lyrica discontinuation syndrome, just like Cymbalta. So let me just get this right. So if you Google Lyrica discontinuation syndrome, it's hard to get off of the medication. The longer you take it, the harder it is. And so, and one of the reasons why is normally when you go off medications, you titrate down. But in many cases, I think, if I remember correctly, now don't quote me on this, it was with Cymbalta and Lyrica, and even the over-the-counter medication that they released the same thing for, is that the company doesn't make lower doses. So, as an example, if the lowest dose is 50 and you want to titrate down, you can't. And getting off of the medication suddenly can cause very, very severe tolerant reactions. What's the right word? Well, discontinuation symptoms. That's the right word, including hallucinations. So I would be careful with that, Kristen. I don't know. I don't know if I personally would use that medication. I mean, I would muscle relaxants to address the muscle issues. And I think I would explore something without those much more challenging effects. They don't tell you about stuff like that, right? And they should. Andrea says, Dr. Robert Evans has been working with me for nearly 10 years. Thank you for working together to give us hope. Yeah, he's a fabulous doctor. He's been our doctor of the year 5 years in a row. I haven't looked at the votes for this year. This is last call. If you've got a doctor, a nurse, a physical therapist who's treating you really, really well, you should nominate them for our year of the awards, doctor of the year, physical therapist of the year, nurse of the year. I'm almost at the point now where I'll be counting votes very, very soon. If you go to icawareness.org, you can vote. Last call, you got another week, and that's it for 2019 votes. Christine just says Lyrica and Cymbalta cause terrible withdrawal. Joan says, I was on Lyrica for neuropathy, but cost and it didn't help. And so again, the Peora, the palmitoethanolamide, if you look at the research for that, what they're finding is that it's working the best for neuropathies like that, neurologically driven pain. So trying something like the Peora would be a hell of a lot safer than the Lyrica based upon discontinuation alone and withdrawal alone. Jacqueline says, I only have a flare after urinating. Would that point to the pelvic floor? Yes, absolutely. If you have a flare after you're done peeing, that points not to your bladder wall, that points to your pelvic floor. If it were your bladder, you would have pain as your bladder filled with urine that was relieved by urination. You don't. Your pain is not worse before you pee or as your bladder's filling. Your pain is worse afterwards. That tells me that your bladder wall's pretty healthy. And that something else other than that, probably a pelvic floor spasm, is at the root of your flares. Guys, you can have a bladder wall flare or you can have a pelvic floor flare. It is what it is. Hey, bio break. I'll be right back. All right, all right, all right, all right. Last call for questions. Last call for questions because the lighting is getting bad and I'm going to have to go feed the folks. Today we are going to have butternut squash tamales with refried beans. And avocado. All right, guys. Last call for questions. Last call for questions. All right. I think hey man, for those of you stuck around, it's time for a giveaway. So why don't we do this? How about if we do Cysto Protect? Cysto Protect. I'm going to give one free bottle of Cysto Protect to somebody right there on Facebook. Hello, Facebook. And one right there on YouTube. So I'm going to, now I don't make it easy anymore. I make it hard. And so let's see how attentive you have been. We will see, and this is going to be fairly easy. So the first person on Facebook, the first person on YouTube who answers this question is going to get a free bottle of Cysto Protect. Or if you don't want the Cysto Protect, you can have a free bottle of the low acid vitamins. Okay, you can tell me. So you can either have Cysto Protect or you can have a free bottle of the Bladder Smart low acid vitamin. Some medications can be very difficult to get off of because they cause difficult symptoms. And we just talked about one, Lyrica, and there's another one, Cymbalta. What is the name of the syndrome that makes it hard for them to get off this medication? What is the name of the syndrome that makes it hard for somebody to get off of Lyrica or off of Cymbalta? We just talked about this 3 minutes ago. Who remembers? No, not the name of the medication, the name of the syndrome. It's Lyrica blank syndrome or Cymbalta blank syndrome. I said to Google it. The medication name blank syndrome. Does anybody remember what it is? Yes, Christine Geiger on Facebook got it. All right, YouTube. YouTube, any guesses? I'm not going to say what it is right away. But Christine Geiger, Christine, can you email me your address, icnetwork@mac.com, and you can tell me which one do you want. Do you want the vitamin or do you want the Cysto Protect? Okay. Good job, hon. Good job. All right. I'm still waiting for YouTube. All right, Patty. So Patty got it right. It's called a discontinuation syndrome. So Patty on YouTube, please email me icnetwork@mac.com, your mailing address, and if you want Cysto Protect or the low acid Bladder Smart low acid vitamin, okay? And I will send it to you. And I got to write this down. So it is Patty. Here, hold on. I've got so much on my desk right now. Donna, if you're watching, you know what I'm looking for. And it was right here. Your thing you gave me was right here, but now it's okay. So Patty T from YouTube and Christine Geiger from Facebook. Your choice. Your choice. Sister Protect or the Bladder Smart low acid vitamin. And so somebody asked, what is this? A discontinuation syndrome means that getting off of a medication is very difficult. That when you get off of certain medications, the side effects are often devastating, like hallucinations. And they can last for months and months and months, 6 months, 8 months, 9 months, a year. And a new FDA just issued a discontinuation. Um, which one was it? Hold on. So the FDA's reports serious harm to patients who are physically dependent on that. But there was also like an antihistamine. Anybody remember which that one? No. I think it was Zantac. Which, here, hold on. No, it's not that one. Hold on. Let me see if I can find this. OTC products with discontinuation syndrome. Antidepressants have a discontinuation syndrome. It was either an antihistamine. I think it was a over-the-counter antihistamine. Anyway, hi Sheila. Now you know where I am. Jamie says, what is Sister Protect? Sister Protect has been around for about 20 years. It was created by an IC researcher years and years and years ago as an alternative supplement for IC. It has a bladder coating effect combined with an antihistaminic effect. We have several supplements now that are very commonly used by the IC community, due in great part to the fact that there are really very, very few traditional FDA approved therapies. Elmeron, unfortunately, is now associated with really severe eye damage. So, and of course, we have cost. So many patients have turned to supplements over the years. So we've got Sister Protect, we've got Sister Renew, and then the two newest supplements, Bladder Rest, which is an $10 cheaper than Sister Protect, but a very, very high quality, made in the USA. But the best supplement on the market right now really is Bladder Builder. And the reason why is because it not only has the bladder coating effects from the chondroitin and the hyaluronate, it also has quercetin in it for an antihistaminic effect. It's got collagen in it for the bladder. It's got beneficial probiotics in it, but most importantly, it has PEA in it for pain relief. So this is a supplement that has the most potential methods of action that could potentially help. And so all of these have been out for some time. Sister Protect is one of the oldest. This is the newest. This came out last year. But you've got some very, very viable options. If you're not where you want to be and you want to try something new, supplements are an alternative. And in fact, they're encouraged by the American Urology Association at step one because they come with so many fewer side effects than the traditional meds. The AUA does not mention brand names, though. The AUA just says explore the over-the-counter stuff. So, Rhonda says, I'm very sensitive with vitamins. Which one would I recommend? Well, if you're talking a multivitamin, Bladder Smart is the low acid multivitamin. And I don't believe in doing vitamins every day unless you're really nutritionally compromised. I think you could do a vitamin once or twice a week, and that could minimize the effect of that. So just come on over to icnetwork.org and you can learn more about it. Sorry, the lights are bad. The sun has gone down. We have been at it now for almost 5 hours. Zyrtec. John Lee, does the compounded one have alcohol? I wish we could get everything in gel form. I'm not sure. You can get all of these on the IC Network website. And the best part about it is it's cheaper over there than it will be on Amazon. Amazon will almost always be $10 to $15 more expensive. And so just go to icnetwork.org, click on our shop. You can see them. All right. All right, my friends. I wish you well. It's been a really fun stream. Happy New Year. I always end my conversations with this. There is no shame, no blame in interstitial cystitis. I don't want you carrying any guilt. I don't want you feeling bad. I don't want you feeling like a failure because absolutely none of that is true. This is not your fault. You have done absolutely nothing wrong. There is no shame. There is no blame because you have IC. I'm going to give you homework. Your homework is for 15 minutes a day, I need you to do something for your spirit to nourish it, whatever it is, whether it's going to church, reading your Bible, or your Quran or whatever. Do something, going and walking among a redwood grove, whatever touches you and gives you peace, do it 15 minutes a day. For 15 minutes a day, I want you to do something for your bladder. Okay, I want you to do something for your bladder, your pelvic floor. Little steps over time. We don't look for big changes. I want little changes, little steps every day. We're building a foundation from the ground up, little bricks. For 15 minutes a day, I want you to do something for your noggin here. Okay, I need you to learn about IC. Come on over to our website, read our new section on confusable diseases. You'd be amazed at how many patients have been misdiagnosed, and we can get them to a better place if you have a proper diagnostic workup. And of course, for 15 minutes a day, please, 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 please do something funny. Watch some funny videos because humor attenuates pain. When pain is accompanied by laughter, your brain will minimize that pain. When pain is accompanied by tears, your brain will intensify that pain. So I need you to laugh. So please come watch some funny videos, okay? And let's end this with our statements. I am strong. I am powerful. I am courageous. I can do anything. Use your I am statements. I had some really good ones there, and they're just out of my head because, hello, it's been 5 hours. So I'm going to say goodbye, everybody. I wish you well. I'll see you shortly. I will be back. Talk to you later. Bye bye. All right, my friends on YouTube. See you later.